Nursing fundamentals may be understood as the disciplined study of care, where scientific inquiry and empathetic presence converge into a unified practice. This academic field carefully examines the intricate ways human life is sustained through precise knowledge, careful observation, and unwavering presence. The very foundation of this work appears to rest upon a profound commitment to well-being, guided by both intellect and an inherent sense of human connection. It explores the quiet intersection where the practitioner becomes both an astute analyst of physiological states and a vigilant guardian of holistic equilibrium. Such a dual role suggests a constant negotiation between objective data and the subjective experience of those requiring support. The insights derived from this discipline could illuminate the fundamental principles governing health, healing, and human resilience in complex circumstances. It tends to reveal how the application of learned information must always be tempered by a deep understanding of individual needs and vulnerabilities. One might therefore consider how this profound act of care, at its very core, reveals something universal about the enduring balance between knowledge and profound compassion. The field of nursing fundamentals exists within a vast and intricate continuum of the health sciences, a domain where numerous disciplines converge to address the complex tapestry of human well-being. It is a space where the rigorous principles of biology often intersect with the profound insights of psychology, all while being guided by the foundational tenets of ethics. This convergence suggests that the understanding of health and illness is rarely confined to a single perspective, but rather necessitates a holistic apprehension of interconnected systems. Within this expansive framework, nursing fundamentals finds its conceptual grounding, drawing sustenance from and contributing to the larger scientific endeavor. One may observe its presence in the intricate web of disciplines dedicated to examining how life itself maintains a delicate order amidst inherent vulnerability. This perspective highlights a fundamental orientation towards resilience and the mechanisms through which living systems respond to various stressors, both internal and external, across the lifespan. The practice and theory of nursing often interact deeply with the established traditions of medicine, though with a distinct focus that differentiates its approach. While medicine frequently concentrates on the diagnosis and treatment of disease, nursing tends to orient itself around the human response to illness, injury, or the potential for health. This subtle yet significant divergence shapes the very nature of care delivery and the philosophical underpinnings of intervention. Furthermore, the field maintains a vital dialogue with sociology, recognizing that individual health is inextricably linked to broader societal structures and community dynamics. It could be said that an understanding of social determinants of health is integral to the contextual application of nursing knowledge. Similarly, philosophy contributes to nursing's ethical framework, prompting reflection on questions of dignity, autonomy, and the moral obligations inherent in providing care to vulnerable populations. Nursing, therefore, occupies a unique and often critical space, bridging the gap between scientific intervention and the broader concept of human restoration. Scientific intervention, with its emphasis on empirical evidence and technological application, provides the tools and techniques for addressing physiological imbalances. Human restoration, conversely, encompasses the psychological, social, and spiritual dimensions of recovery, aiming to return individuals to a state of wholeness or optimal function within their unique circumstances. This positioning clarifies why the provision of care is not merely a technical exercise, but rather a deeply systemic undertaking. It necessitates an understanding that extends beyond the immediate presenting symptoms to encompass the individual's lived experience, their environment, and their personal resources for healing. The efficacy of a nursing intervention may, therefore, depend as much on its technical precision as on its contextual appropriateness, and its alignment with the patient's holistic needs. The foundational principles of nursing implicitly acknowledge this systemic nature, recognizing that a person's health trajectory is influenced by a multitude of factors, some biological, others psychological, and many sociocultural. To address these requires a fluid approach, one that integrates knowledge from diverse fields into a cohesive strategy for support and advocacy. This integrative capacity defines much of the contextual relevance of nursing fundamentals. One may consider the way in which the body's physiological responses, governed by biological laws, are invariably modulated by psychological states, such as stress or hope. These psychological states, in turn, are often shaped by social support networks or cultural beliefs, creating a complex interplay that demands a nuanced understanding. Nursing, by its very nature, seeks to navigate these intricate relationships, providing care that respects the individual as a composite of these interacting forces. The boundaries of nursing within this continuum are often permeable, allowing for a dynamic exchange of knowledge and methodologies with allied health professions. This fluidity ensures that the field remains responsive to evolving understandings of health and disease, and adaptive to the changing needs of populations. It also underscores the collaborative spirit that tends to characterize effective healthcare teams, where each discipline contributes its unique contextual lens. Yet, the precise demarcation of these interwoven domains often remains a subject of ongoing academic discourse, challenging any singular definitive categorization of where one field begins and another ends. This inherent complexity suggests that the contextual understanding of nursing is not static, but rather an evolving construct, continually refined through research and practice. It requires a sustained commitment to interdisciplinary dialogue and a willingness to integrate new perspectives into existing frameworks. Understanding this expansive position of nursing within the health sciences is paramount for anyone seeking to grasp its fundamental contributions. It provides the necessary lens through which to view care not as a series of isolated tasks, but as an integrated process aimed at fostering well-being across multiple dimensions. The recognition of this systemic context illuminates the profound impact that thoughtful, holistic care can have on the trajectory of human restoration, emphasizing that true healing often transcends the purely technical. The foundational practice of nursing tends to be guided by a structured, cyclical framework of core principles. This systematic approach establishes a logical progression, moving thoughtfully from initial perception and data gathering to deliberate action and subsequent critical reflection on outcomes. It forms a continuous, adaptable loop designed to optimize the provision of care within any given context, ensuring a comprehensive and responsive engagement with health and well-being. The initial and perhaps most pervasive phase, known as assessment, involves the systematic and comprehensive collection of information concerning an individual's health status. This crucial step encompasses both objective observations, which are measurable facts, and subjective reports, which convey personal experiences and feelings. Together, these diverse elements contribute to the formation of a holistic and nuanced picture of present conditions and potential needs, extending beyond mere symptoms. Careful attention to detail during this extensive stage often dictates the clarity and accuracy of all subsequent clinical decisions, laying the groundwork for effective intervention. One might gather data through physical examination, careful observation of behavior, and thorough review of health history. The depth of this initial understanding profoundly influences the trajectory of care. Objective data might include a precise measurement of the body's core temperature, ideally maintained around 37 degrees Celsius, reflecting a stable internal thermal environment essential for physiological function. This figure provides a clear, quantifiable marker of systemic equilibrium. Any significant deviation may signal an underlying physiological alteration requiring attention. Similarly, a resting pulse rate of approximately 70 beats per minute often indicates an efficient and rhythmic cardiovascular system, signaling adequate circulatory dynamics. This metric offers insight into the heart's capacity to pump blood effectively throughout the body. Consistent variations could suggest circulatory challenges. Blood pressure, frequently observed near 120/80 millimeters of mercury, suggests a balanced systemic pressure within the vascular network, indicative of healthy perfusion to vital organs. These readings provide a critical snapshot of the force exerted by circulating blood. Deviations from this range might prompt further investigation into cardiovascular health. These quantifiable metrics serve as vital anchors, providing measurable insights into physiological balance within the living system. They offer a concrete baseline against which any deviations or improvements may be carefully noted, tracked, and interpreted over time. Such objective data forms a critical part of the initial understanding of an individual's physical state and functional capacity, offering a consistent reference point. Following the thorough collection of assessment data, the process moves into the interpretive phase known as diagnosis. Here, all gathered information is meticulously analyzed and synthesized to identify actual or potential health problems and human responses to health conditions. This stage requires a significant degree of critical thinking and clinical judgment to discern meaningful patterns from disparate pieces of information, allowing for the formulation of a coherent understanding of an individual's specific needs. A nursing diagnosis, distinct from a medical diagnosis, tends to focus on the individual's unique responses to health conditions or life processes, rather than solely on the disease itself. It might describe, for instance, an altered comfort level or impaired mobility, rather than a specific pathological condition. This distinction is crucial for guiding holistic, person-centered interventions. The diagnostic statement serves as a guiding principle for the subsequent planning phase, clearly articulating the specific areas that require targeted intervention and support. It transforms raw data into a problem statement, providing direction for action. This interpretive step is central to the personalization of care, ensuring interventions are tailored to the individual's lived experience. The planning stage then entails the meticulous development of a comprehensive and individualized care strategy, which involves setting realistic, measurable goals and outlining specific, evidence-based interventions. These plans are typically designed through collaborative efforts, aiming to address the identified diagnoses effectively and promote optimal well-being and recovery. Each potential step within the plan is carefully considered for its anticipated impact, its feasibility within the given resources, and its alignment with the individual's preferences and values, ensuring a respectful approach. Goals established during this phase should be specific, measurable, achievable, relevant, and time-bound, providing clear targets against which progress and recovery can be objectively evaluated. One might set a goal for a patient to ambulate a certain distance by a specific date, for example. The interventions chosen are consistently grounded in established best practices and current research, ensuring that all actions are both therapeutically sound and ethically responsible, fostering consistency and quality in care delivery. This proactive phase requires foresight and strategic thinking. Implementation represents the active and dynamic phase, where the carefully planned interventions are systematically carried out, with professional skill, compassionate engagement, and continuous vigilance. This crucial stage may involve a wide range of direct care activities, such as medication administration, wound care, or assistance with daily living, alongside vital patient education, advocacy for individual needs, and seamless coordination with other healthcare professionals. It is during implementation that theoretical plans transform into tangible support and practical assistance, directly impacting the individual's health trajectory and comfort. Executing interventions requires not only a profound understanding of individual needs, but also a highly responsive and adaptive approach to changing circumstances and emerging challenges. One must constantly assess the individual's reactions and adjust the approach as necessary. The practical application of knowledge and the demonstration of clinical competence during this stage are absolutely vital for achieving the desired outcomes and fostering an environment conducive to healing and recovery, embodying the direct engagement aspect of professional nursing practice. Finally, evaluation completes the continuous cycle, involving a systematic assessment of the effectiveness of the implemented interventions and the degree to which established goals have been achieved. This reflective process critically determines whether the care plan has been successful in addressing the identified needs, or if modifications, adjustments, or entirely new approaches are necessary. It provides an indispensable opportunity for continuous improvement and refinement of care strategies based on real-world outcomes, ensuring adaptability. During evaluation, one may meticulously consider if the individual's body temperature has stabilized consistently near 37 degrees Celsius, or if their pulse rate remains reliably around 70 beats per minute, indicating sustained physiological equilibrium. A sustained blood pressure of 120/80 millimeters of mercury might further indicate successful management of circulatory health and overall systemic balance. These objective markers offer invaluable, quantifiable feedback regarding the physical efficacy of the care provided and the progress made towards established physiological norms. Subjective reports from the individual are equally vital during evaluation, providing insight into their perceived comfort, understanding, and overall sense of well-being. Their feedback helps to gauge the human impact of the interventions. This comprehensive review then informs any necessary reassessment, restarting the cycle with refined understanding. This continuous and intricately linked cycle of assessment, diagnosis, planning, implementation, and evaluation tends to form the dynamic and responsive core of nursing fundamentals. Each principle flows logically and seamlessly into the next, creating an adaptable and robust framework for truly responsive and person-centered care. The inherent interconnectedness of these stages ensures that a holistic approach to health and well-being is consistently maintained, allowing for constant adaptation to the evolving needs of the individual. The entire framework operates as a self-correcting mechanism, where insights gained from one phase directly inform and refine all subsequent actions, fostering a truly dynamic system of support and healing. Yet one academic tension arises whether standardized measurement can ever fully capture the profound and multifaceted nature of subjective human experience. While objective data provides undeniably essential insights into physiological states and measurable responses, the lived reality of health, illness, and well-being often transcends the limitations of quantifiable metrics alone. This presents a persistent and complex challenge within the discipline, requiring constant consideration of the interplay between the observable and the deeply felt. The individual's deeply personal perception of pain, their intricate emotional state, their unique cultural interpretations of health, or their personal understanding of overall well-being may not be fully encapsulated or adequately represented by numerical values or standardized scales. These qualitative aspects resist easy quantification, yet they hold immense significance for the individual. Harmonizing the precision and reliability of objective data with the inherent variability and richness of human experience, appears to be a continuous and evolving pursuit within nursing practice, demanding a sophisticated approach. This delicate balance requires a profound blend of scientific observation, critical reasoning, and empathetic understanding. It necessitates a constant awareness that the numbers, while crucial for certain aspects, tell only a part of the complex human story. True precision in nursing, therefore, seems to reside in the artful and deliberate harmonization of quantifiable, evidence-based data with the profound, irreducible variability of human experience. This integrated approach ensures that care remains not only scientifically sound and clinically effective, but also deeply human-centered, respectful, and responsive to the individual's holistic needs. It encapsulates the enduring quest for balance between the objective and subjective within the intricate tapestry of the living system, reflecting a commitment to comprehensive and compassionate care that respects both data and dignity. The understanding of nursing fundamentals often takes the form of a complex, layered architecture, where each stratum builds upon the one beneath it. At its foundational level, this structure concerns biological stability, meticulously ensuring the fundamental physiological needs of the patient are met with precision and consistent vigilance. Ascending from this primary concern, the next tier involves emotional adaptation, where practitioners cultivate an astute understanding of human psychology and the nuanced responses to illness. This layer supports the capacity to connect with individuals, fostering an environment conducive to their emotional well-being and recovery. Further still, ethical reasoning forms a critical stratum, guiding decisions through principles of justice, beneficence, and non-maleficence in patient care. The highest tier often appears as spiritual presence, acknowledging the profound human need for connection and meaning, even amidst suffering, much as the body supports breath. However, within this structured framework, academic debate continues regarding the precise demarcation where professional boundaries conclude and the expansive realm of empathy truly begins. This tension suggests that the architecture of nursing is not static, but rather a fluid construct shaped by ongoing inquiry and evolving human needs. The structure of nursing practice thus seems to evolve dynamically, often reflecting the deepening understanding of its inherent moral and human dimensions. It represents a resilient and self-correcting system, continuously adapting to the complex demands of care. The rhythm of healing within nursing appears to unfold as a series of profoundly continuous processes, each intricately linked and perpetually responsive to the patient's evolving state. This dynamic interplay tends to mirror the vital, self-regulating systems of the human body itself, where subtle, ongoing corrections continuously maintain an essential physiological equilibrium. Such an inherent rhythm suggests that comprehensive patient care is never a static application of protocols, but rather a living, adaptive engagement with ever-changing physiological and psychological landscapes. The very essence of nursing practice manifests through these sequential yet deeply overlapping phases, each contributing indispensable elements to the restoration of health and well-being. Observation, as a foundational and indispensable nursing process, involves the systematic, attentive, and highly skilled gathering of information regarding a patient's holistic condition. It encompasses both overt, tangible physical manifestations and the more subtle, nuanced cues that may indicate underlying shifts in health status or potential complications. A nurse might meticulously note the exact color and turgor of the skin, the presence or absence of edema in extremities, or the precise quality of a patient's verbal and non-verbal responses during interaction. This initial, comprehensive phase establishes the perceptual groundwork upon which all subsequent care decisions are meticulously built. forming a detailed baseline understanding of the individual's current physiological and psychological state. The continuous, vigilant monitoring of vital signs, for instance, provides objective, quantifiable data that critically guides immediate interventions and informs long-term care strategies, offering a crucial window into the patient's internal physiological functions. The act of observation extends far beyond mere visual inspection, consciously integrating auditory, tactile, and even olfactory assessments to create a multisensory, holistic understanding of the patient's presentation. Listening intently to lung sounds might reveal the distinctive crackles of pulmonary edema or the characteristic wheezes associated with bronchial constriction, indicating significant respiratory compromise. Similarly, carefully palpating a peripheral pulse offers critical insights into cardiac rhythm, strength, and perfusion, reflecting the efficiency of the circulatory system. Such careful and deliberate attention to minute detail allows the astute nurse to perceive critical shifts in condition that might otherwise remain unnoticed, ensuring a proactive and timely approach to patient care. This comprehensive data collection is not a passive reception of information, but an active, focused, and purposeful engagement, demanding both refined clinical acumen and a deep, empathetic connection with the individual. Interpretation emerges as the profound cognitive process through which meticulously collected observational data acquires its essential meaning within the complex nursing context. This crucial phase involves rigorously analyzing observed patterns, comparing current findings with established physiological norms and expected trajectories, and precisely identifying potential health challenges or emergent risks that unequivocally require intervention. The nurse might interpret a sudden significant drop in systemic blood pressure alongside a compensatory increase in heart rate as a strong indication of hypovolemia or impending shock, necessitating immediate attention and further diagnostic exploration. Such sophisticated analytical reasoning transforms raw, disparate pieces of data into coherent, actionable clinical insights, critically guiding the precise direction of subsequent therapeutic endeavors. It necessitates a deep, integrated understanding of pathophysiology, pharmacology, and patient-specific factors, allowing for highly nuanced distinctions between various clinical presentations and their complex underlying causes. This interpretive phase relies heavily upon the exercise of sound clinical judgment, a complex and highly refined skill developed through extensive education, rigorous training, and accumulated practical experience, enabling the nurse to synthesize diverse pieces of information into a cohesive whole. It involves not only accurately recognizing deviations from a healthy state, but also profoundly understanding the potential implications of these deviations for the patient's overall well-being and prognosis. The ability to connect seemingly unrelated symptoms or subtle changes to a comprehensive, cohesive clinical picture is absolutely central to the provision of effective nursing care, ensuring that all interventions are precisely targeted and therapeutically appropriate. Without the capacity for sound interpretation, even the most meticulous observations might regrettably remain inert, failing to translate into meaningful, life-sustaining care. Action, the third crucial and ethically charged process, involves the deliberate implementation of carefully planned interventions, specifically designed to address identified patient needs and actively promote the process of healing. These diverse actions may range from the precise administration of prescribed medications, with meticulous timing and dosage, to providing essential comfort measures that alleviate physical distress, or to educating patients comprehensively on vital self-care techniques for managing chronic conditions. The nurse's actions are always rigorously guided by established, evidence-based protocols, current best practices, and individualized care plans ensuring both safety and optimal efficacy in every therapeutic endeavor. This phase profoundly translates theoretical knowledge and refined clinical judgment into tangible, compassionate support for the patient's often challenging journey toward improved health outcomes, embodying the practical and ethical application of nursing science. The execution of these actions demands both exceptional technical proficiency and a profound, unwavering sense of professional responsibility. As each intervention carries potential, sometimes significant, consequences for the patient's health and recovery. Administering an antibiotic, for example, requires not only careful calculation of dosage and route, but also a vigilant awareness of potential allergic reactions and drug interactions, while assisting with ambulation necessitates an expert understanding of fall risks, proper body mechanics, and patient limitations. Each action is a deliberate, purposeful step within the larger, integrated framework of care, contributing directly and meaningfully to the patient's recovery, palliation, or rehabilitation. This active engagement is precisely where the art and the science of nursing converge, transforming abstract assessment into concrete, life-affirming therapeutic impact. Reassessment completes the inherently cyclical nature of nursing processes, involving the continuous, vigilant evaluation of the patient's response to implemented interventions and the overall effectiveness of the established care plan. This ongoing monitoring allows for necessary and often immediate adjustments, ensuring that care remains profoundly responsive to the patient's continually evolving condition, and that interventions consistently meet their intended therapeutic goals. A nurse might observe that a patient's reported pain has significantly diminished after medication administration, or that a wound dressing requires more frequent changes due to an unexpected increase in exudate, each observation prompting a thoughtful modification to the existing care strategy. This reflective feedback loop is absolutely fundamental to adaptive nursing, actively preventing static, inflexible approaches and fostering dynamic, truly patient-centered care that continuously evolves with the individual. The process of reassessment is not merely a superficial check-in, but a critical, comprehensive re-evaluation that can, if necessary, lead to a complete revision of the entire care plan. It involves rigorously comparing current patient data against previous observations, established baselines, and expected physiological outcomes, diligently identifying any discrepancies, unexpected responses, or emerging complications. This continuous vigilance ensures that nursing care remains agile, effective, and ethically sound, always seeking to optimize the patient's comfort, safety, and recovery trajectory. The ability to reassess critically ensures that the path to healing remains precisely aligned with the individual's unique progression, actively preventing stagnation and consistently promoting ongoing improvement and adaptation. Within this dynamic and intricate framework, precise numeric context provides a crucial, objective anchor, offering quantifiable insights into complex physiological states and responses. Respiration, for example, typically registers around 16 breaths per minute in a resting adult, yet significant deviations, such as tachypnea or bradypnea, may immediately signal respiratory distress or systemic recovery, requiring urgent attention. Oxygen saturation often appears at 98% or higher, as measured by pulse oximetry, reflecting efficient gas exchange within the pulmonary system, which is a vital indicator of adequate tissue oxygenation. Body temperature tends to stabilize precisely near 37 degrees Celsius, a critical parameter for maintaining metabolic regulation and robust immune function, with even slight, persistent variations, warranting thorough investigation for underlying causes. Administering intravenous fluids, for instance, might involve a precise infusion rate of 125 milliliters per hour, delivering essential hydration and electrolytes over a 24-hour period to meticulously maintain fluid balance and circulatory volume. A medication dosage could specify 2 milligrams of a potent analgesic to be administered every 4 hours, carefully titrated to manage acute pain levels effectively without inducing excessive sedation or adverse effect. Total blood volume, approximating 5 liters in an average adult, profoundly influences fluid replacement strategies during hemorrhage or dehydration, ensuring the preservation of circulatory stability and adequate tissue perfusion. These precise, quantifiable measurements offer objective benchmarks against which patient progress may be rigorously evaluated and care adjusted. Yet, even with such meticulous observation, precise measurement, and diligently applied interventions, the inherent, profound variability within human physiology ensures that no two patient responses are ever truly identical, introducing an unavoidable element of uncertainty and adaptive challenge into every individual care plan. This persistent individuality means that nursing is not a static repetition of fixed, immutable protocols, but a living, breathing adaptation, constantly guided by acute, perceptive reason and refined clinical judgment. The subtle, often unpredictable interplay of internal biological factors and external environmental influences can shift outcomes in unforeseen ways, demanding continuous vigilance, profound flexibility, and empathetic responsiveness from the caregiver. The profound complexity of human health and illness means that even the most predictable numeric outcomes may sometimes diverge significantly from expected trajectories, challenging established norms and theoretical models. A patient's subjective pain perception, for example, may not always align directly with objective physiological indicators or standardized pain scales, unequivocally requiring a more nuanced, individualized approach to management that respects their lived experience. Similarly, the trajectory of recovery from a complex infection might proceed at a significantly different pace than initially anticipated, influenced by myriad personal genetic predispositions, comorbidities, and environmental factors. This crucial acknowledgement of inherent variability profoundly underscores the adaptive, dynamic, and deeply human nature required in truly effective nursing practice. These interconnected processes of observation, interpretation, action, and reassessment thus form the living, evolving framework of nursing practice, enabling continuous and responsive adaptation to the patient's ever-changing needs. They flow together seamlessly, much like the sophisticated, self-regulating systems of the human body, constantly striving to restore and maintain a delicate state of equilibrium amidst inherent change and individual uniqueness. The overarching purpose of this rhythmic, compassionate engagement is ultimately to facilitate the patient's journey toward optimal health and well-being, guided by perceptive reason, evidence-based practice, and profoundly compassionate application. This continuous, iterative cycle ensures that care remains dynamic, responsive, ethically grounded, and deeply human in its essence. Nursing, as a foundational discipline, appears to embody a continuous state of transformation, its trajectory over time understood as a dynamic response to shifting human needs and scientific advancements. This evolution is not a linear progression, but rather a complex interplay of adaptation and enduring principles that define its core function. One might observe cycles of innovation, followed by periods of consolidation within its expanding scope, reflecting a persistent drive towards greater efficacy and ethical practice. The discipline tends to refine its understanding of health and humanity through these ongoing changes. Historically, The essence of nursing may be traced back to instinctive acts of caregiving, an inherent human response to suffering and vulnerability. Early forms of assistance, often rooted in familial or communal support structures, provided comfort and basic aid in times of illness or injury. These initial gestures, while lacking formal structure, laid the groundwork for the compassionate core that continues to define the profession. It could be said that this ancient function to preserve life has remained a steadfast anchor throughout its many transformations. The movement from purely instinctive care towards a more formalized practice marks a significant phase in nursing's evolution. Driven by a growing recognition of systematic knowledge, early figures began to organize care, observing patterns of disease and developing rudimentary methods for hygiene and patient comfort. These pioneers initiated the slow but steady shift towards an articulated body of knowledge, moving beyond mere intuition. The establishment of early training programs, however informal, signaled a nascent understanding of the need for structured learning. As societies advanced, so too did the demands placed upon those who provided care, necessitating a more robust framework for nursing practice. The Industrial Revolution, for instance, introduced new health challenges related to urban living and working conditions, prompting a re-evaluation of public health needs. This era appears to have catalyzed the professionalization of nursing, shifting it from a charitable endeavor to a recognized skilled occupation. The formalization of nursing education began to take root, establishing curricula and standards for practice. One significant form of adaptation in nursing fundamentals has been the continuous formalization of knowledge, moving from anecdotal experience to evidence-based practice. This shift reflects a broader intellectual current across scientific disciplines, emphasizing systematic inquiry and empirical validation. Nursing theory began to emerge, providing conceptual models that explained phenomena and guided interventions, thereby elevating the discipline's academic standing. The development of specialized research methodologies allowed for rigorous investigation into care outcomes and patient experiences. The integration of research findings into daily practice has profoundly reshaped how nurses approach patient care, moving away from tradition-bound methods. This commitment to evidence means that interventions are continuously evaluated and updated based on the latest scientific understanding. For example, the volume of new medical knowledge, which may be observed to expand at an exponential rate, potentially doubling every 73 days, necessitates constant assimilation and re-evaluation within nursing practice. Such an accelerating curve of understanding challenges the discipline to continuously update its foundational tenets and educational frameworks, ensuring that practitioners remain at the forefront of health science. Another pivotal form of adaptation involves the integration of technology, which has consistently reshaped the tools and techniques available to nurses. From the introduction of basic sterile techniques to the advent of complex diagnostic imaging and life support systems, technology has expanded the capabilities of care providers. The adoption of electronic health records, for instance, has transformed information management, allowing for more efficient communication and data analysis. This technological embrace appears to enhance precision and safety in patient care, albeit with new demands on professional competencies. The discipline's response to societal shifts represents a third crucial form of adaptation, demonstrating its inherent flexibility in meeting evolving public health needs. As demographic patterns change, with populations aging or experiencing new disease burdens, nursing roles tend to expand and specialize accordingly. The rise of chronic diseases, for example, has necessitated a greater focus on health, education, and long-term care management. Nursing has consistently adapted its focus to address prevalent health issues, from infectious disease outbreaks to mental health challenges. and global pandemics. The evolution of nursing also involves cycles of consolidation, where established practices are refined and reinforced, ensuring quality and consistency. Following periods of rapid expansion or innovation, there tends to be a phase of integrating new knowledge and techniques into standardized protocols. This process helps to embed advancements securely within the discipline, making them accessible and reliable across diverse care settings. It appears that this cyclical pattern of growth and stabilization contributes to the overall resilience and robustness of nursing practice. Yet, within this dynamic process of evolution, one may also discern elements of decay, not necessarily as a negative decline, but rather as the natural obsolescence of outdated practices or theories. Methods once considered standard may be superseded by more effective, safer, or ethically superior alternatives. For instance, certain traditional remedies or care approaches, lacking empirical support, tend to fade as evidence-based alternatives emerge. This continuous critical evaluation ensures that nursing practice remains current and avoids stagnation, shedding what no longer serves its core purpose. The enduring academic tension between specialization and holistic care remains a central theme in nursing's ongoing evolution. While the increasing complexity of medical science often necessitates deep expertise in specific areas, the fundamental commitment to treating the whole person persists. This dichotomy tends to foster continuous dialogue and innovation, as the discipline seeks to integrate highly specialized knowledge within a comprehensive, patient-centered framework. It appears that the strength of nursing lies in its ability to evolve without losing its ethical center, consistently striving for this intricate balance. Despite rigorous planning and foresight, the future trajectory of nursing's evolution appears to hold an inherent unpredictability, shaped by emergent global health crises and unforeseen scientific breakthroughs. One cannot fully anticipate the next great challenge or the precise technological leap that will redefine care. This inherent uncertainty necessitates a discipline that is not only adaptive, but also resilient and capable of rapid, informed response. The capacity for flexible adaptation, therefore, becomes a hallmark of its continued relevance and vitality. Ultimately, the long arc of nursing's evolution illustrates a profound commitment to human well-being, characterized by an adaptive spirit and an unwavering ethical compass. The discipline continually balances the incorporation of new knowledge and technologies with the preservation of its fundamental humanistic values. It tends to appear that this dynamic equilibrium, where change is embraced yet core principles are maintained, ensures its enduring relevance. The continuity of its purpose, to care and to heal, remains steadfast amidst the constant currents of progress and transformation. The practice of nursing fundamentals may be understood as an intricate act of integration, binding together diverse streams of knowledge into a cohesive professional endeavor. This synthesis appears essential for comprehensive patient care, demanding a constant harmonizing of disparate elements. It could be said that this continuous weaving of understanding forms the very fabric of effective nursing. The fundamental purpose of this integration involves transcending mere disciplinary boundaries, fostering a unified perspective on health and illness. It seeks to perceive the individual not as a collection of isolated systems, but as a complex, interconnected whole. This holistic view underpins every aspect of nursing intervention and reflection. Physiological understanding forms a foundational layer, revealing the body's intricate mechanisms and their complex interdependencies. A nurse interprets vital signs, assesses physical responses, and recognizes subtle patterns indicating health or deviation from the norm. This biological insight provides the initial, objective framework for clinical assessment and intervention planning. Simultaneously, Psychological awareness profoundly informs the nurse's approach to a patient's emotional and mental state. Factors such as anxiety, coping mechanisms, and cognitive function significantly influence an individual's experience of illness and their capacity for recovery. Understanding these human dimensions allows for a more empathetic and ultimately effective interaction. Ethical considerations then provide the indispensable moral compass, guiding every decision and interaction with profound sensitivity and integrity. Principles of autonomy, beneficence, non-maleficence, and justice shape the very essence of nursing interventions and professional conduct. This ethical grounding ensures that practice remains compassionate, respectful, and centered on the dignity of the person. Sociological insights further enrich this integrated understanding, recognizing the profound impact of social determinants on health and well-being. Cultural contexts, family dynamics, and community resources all play a crucial role in shaping a patient's health trajectory. Incorporating these factors allows for care that is truly person-centered and culturally sensitive. Pharmacological knowledge, while specialized, must also be seamlessly integrated into the broader nursing assessment and care plan. Understanding medication actions, interactions, and potential side effects is critical for safe and effective administration. This technical knowledge becomes meaningful only when viewed through the lens of individual patient needs. Effective communication science provides the essential conduit through which all these integrated understandings are conveyed and received. Therapeutic communication skills enable nurses to gather crucial information, build trust, and educate patients and their families. This allows for a shared understanding of the health journey. The core principles of nursing, established as its theoretical bedrock, find their practical expression through integrated conceptual structures. These structures, perhaps encompassing various care models or theoretical frameworks, guide the systematic application of knowledge in diverse clinical settings. Within these frameworks, dynamic processes unfold, transforming abstract conceptualizations into tangible, patient-centered actions. Knowledge originating from various scientific disciplines thus merges seamlessly within the nursing paradigm, creating a rich tapestry of understanding. Anatomy, pharmacology, sociology, and philosophy do not remain isolated academic domains, but rather contribute their unique insights. Their convergence creates a richer, multifaceted understanding of human health, illness, and recovery. The nurse, in essence, functions as a central interpreter, translating disparate signals emanating from the body and the mind. These raw data points are then meticulously woven into coherent patterns of understanding, revealing underlying conditions or needs. This continuous interpretive act allows for the formulation of informed judgments and the design of tailored, individualized interventions. This coherent act of nursing transcends mere technical skill or the rote application of standardized procedures. It embodies a profound intellectual and compassionate synthesis. It involves a continuous, dynamic interplay of observation, critical analysis, reflective judgment, and empathetic response. Such deep integration forms the indispensable bedrock of truly effective and profoundly humane care delivery. The process of integration begins with thorough assessment, where fragmented pieces of data are systematically collected and categorized. This initial phase demands an acute awareness of all potential contributing factors, from biological markers to expressed emotional states. It lays the groundwork for subsequent synthesis. During the diagnostic phase, these collected data points are then synthesized to identify patterns and formulate clinical judgments. The nurse integrates physiological signs with psychological cues and social context to arrive at a comprehensive understanding of the patient's health problem. This requires a sophisticated level of cognitive processing. Planning care necessitates an integrated approach, drawing upon evidence-based practices while tailoring them to individual needs and preferences. The nurse must reconcile general guidelines with specific patient circumstances, ensuring that interventions are both effective and appropriate. This balancing act defines much of the planning process. Implementation of care plans then requires an integrated application of skills, knowledge, and ethical considerations in real time. Each action, from administering medication to providing emotional support, reflects a confluence of various domains of understanding. The nurse's presence itself becomes an integrated act of care. Finally, evaluation demands an integrated assessment of outcomes, considering not only physiological responses, but also psychological well-being and social adaptation. The effectiveness of care is measured by its holistic impact on the patient's life. This iterative process refines future interventions. One might ponder then how complete an integration is truly achievable within such a complex and ever-evolving professional field. The sheer breadth of knowledge required, combined with the dynamic nature of human experience, presents a perpetual challenge to perfect synthesis. This ongoing quest for coherence defines much of the intellectual endeavor in nursing. A tension persists, however, regarding whether complete integration remains an elusive ideal rather than a static, fully attainable unity in such a dynamic professional landscape. The inherent variability of individual responses and the continuous emergence of new scientific insights suggest that perfect, unchanging coherence might be perpetually just beyond reach. This inherent dynamism necessitates constant adaptation. It could be said that nursing coherence manifests not as a fixed state of unified knowledge, but rather as a continuous, active negotiation. This profound negotiation occurs between the vast, expanding expanse of scientific knowledge and the profound, often immediate, demands of human compassion. The delicate balance between these forces is perpetually sought and refined in practice. The inherently dynamic nature of human experience necessitates a flexible and adaptive approach to integration within nursing practice. Each patient presents a unique constellation of physiological, psychological, social, and spiritual factors that demand individualized attention. This calls for a responsive and fluid synthesis of information, adapting to specific circumstances rather than rigid adherence. Compartmentalizing knowledge may simplify initial learning and theoretical categorization, yet it often fails to capture the intricate reality of patient needs. True nursing skill lies in actively dissolving these artificial disciplinary boundaries. It allows for a fluid, intuitive interplay of insights drawn from all contributing domains, fostering a more holistic perspective. This profound integration highlights the enduring and essential interplay between the art and the science of nursing, each complementing the other. Scientific rigor provides the evidence base, the systematic approach, and the measurable outcomes that underpin effective interventions. The art, conversely, offers the intuitive wisdom, the personalized touch, and the compassionate presence essential for truly holistic care. The depth and quality of this integration directly influence the efficacy and humanity of patient outcomes across various care settings. When knowledge streams are harmonized and applied thoughtfully, care plans tend to be more comprehensive, person-centered, and ultimately more effective. This integrated approach tends to lead to improved well-being, faster recovery, and enhanced patient satisfaction. Reflection plays a critically important role in refining and strengthening this integrative capacity within the individual practitioner. Nurses continuously review their actions, analyze patient responses, and critically appraise their underlying knowledge bases. This consistent reflective practice deepens understanding and strengthens the internal coherence of their clinical approach. The sheer volume of new information, coupled with rapidly evolving best practices and technological advancements, presents an ongoing challenge to achieving comprehensive integration. Maintaining a current, synthesized, and internally coherent knowledge base requires persistent dedication and continuous engagement with learning. It often involves a lifelong commitment to professional development. Ultimately, the overarching goal of this integrative process remains a unified understanding of the human condition in both health and illness. Nursing endeavors to perceive the individual not merely as a collection of isolated symptoms or malfunctioning biological systems. Instead, it strives to view them as a whole, interconnected being, deserving of complete and compassionate attention. Critical thinking forms the intellectual engine of integration, allowing the nurse to analyze complex situations and synthesize disparate pieces of information. It enables the discerning evaluation of evidence, the identification of underlying assumptions, and the formulation of reasoned judgments. This cognitive process is central to coherent practice. Clinical judgment, a refined form of integrated thinking, permits the nurse to make timely and appropriate decisions in dynamic care environments. It combines theoretical knowledge with practical experience and intuitive understanding of the patient's condition. This blend of explicit and tacit knowledge defines expert practice. The impact of accumulated experience significantly enhances a nurse's capacity for integration, allowing for quicker pattern recognition and more nuanced responses. With time, the connections between various aspects of care become more apparent and fluid. This experiential learning refines the integrative process. Integration extends across the lifespan, adapting its focus and methods for diverse populations, such as pediatrics or geriatrics. The specific physiological, psychological, and social needs of children differ markedly from those of older adults. This requires a flexible and age-appropriate synthesis of knowledge. Similarly, integration is vital across various nursing specialties, from medical surgical to mental health or community care. Each specialty demands a unique emphasis on certain knowledge domains, yet all require a holistic synthesis. The core principle of integrated care remains constant. The challenge of information overload in contemporary healthcare necessitates sophisticated integrative strategies from nurses. Navigating vast amounts of electronic health record data and research findings requires an ability to distill essential information. This prevents fragmentation of understanding. Interdisciplinary collaboration is a crucial external mechanism for fostering integration, bringing together diverse professional perspectives. Nurses work alongside physicians, therapists, social workers, and other specialists to create a unified care plan. This collective intelligence enhances overall coherence. This integrated approach actively prevents fragmented care, which often results from a narrow, siloed focus on individual symptoms or specialties. Fragmentation can lead to missed connections, conflicting treatments, and a diminished patient experience. Integration serves as a corrective force. Moreover, effective integration directly supports patient safety by ensuring all relevant factors are considered in decision-making. A comprehensive understanding of the patient's situation reduces the likelihood of errors or adverse events. It promotes a more secure care environment. The ethical implications of fragmented versus integrated care are profound, touching upon issues of dignity, respect, and justice. Fragmented care may inadvertently dehumanize patients by reducing them to their ailments. Integrated care upholds their inherent worth. The philosophical basis for holistic integration rests on an understanding of the human being as an indivisible entity, where mind, body, and spirit are inextricably linked. This perspective challenges reductionist views, advocating for a comprehensive approach to healing. It guides the nurse's fundamental orientation, intuition, developed through years of integrated practice, often plays a subtle yet powerful role in clinical decision-making. It represents a rapid, subconscious synthesis of vast amounts of information and past experiences. This gut feeling can sometimes guide critical actions. The concept of knowing the patient epitomizes an integrated understanding, extending beyond medical facts to encompass their personal story, values, and aspirations. This deep familiarity allows the nurse to anticipate needs and provide truly individualized care. It transcends mere data points. Continuous learning is not merely an academic requirement, but an essential component of maintaining integrative capacity in nursing. The dynamic nature of health science demands ongoing engagement with new research, evolving theories, and best practices. This ensures knowledge remains current and coherent. The reflective practice cycle serves as a powerful internal mechanism for integration, allowing nurses to process experiences and refine their conceptual frameworks. By consciously reviewing actions and outcomes, practitioners can identify gaps in understanding and strengthen their holistic approach. This iterative process fosters growth. A tension may arise between the push for standardization in healthcare and the need for individualized, integrated care. While protocols offer efficiency and safety, they must be flexibly applied to suit unique patient contexts. Balancing these demands requires astute judgment. The impact of technology on integration is complex, as it provides vast amounts of data that simultaneously aid and challenge synthesis. Electronic health records consolidate information, yet the nurse must still interpret and integrate these data points into a coherent narrative. This requires human discernment. The human element remains paramount in synthesizing diverse inputs, as no algorithm can fully replicate the nuanced understanding required for patient care. Empathy, judgment, and the ability to connect disparate pieces of information are uniquely human capacities. These are indispensable for true integration. The concept of pattern recognition is central to integrated nursing, allowing experienced practitioners to quickly identify familiar constellations of symptoms and responses. This ability stems from having integrated countless individual cases and theoretical insights over time. It represents a higher order of cognitive function. The influence of environmental factors on the integration of care is significant, as the patient's surroundings can profoundly impact their well-being. A nurse considers the home environment, community resources, and institutional settings when planning and delivering holistic interventions. This broadens the scope of integration. Spiritual dimensions often integrate subtly with physical and psychological aspects of care, reflecting a patient's deepest values and sources of meaning. Addressing spiritual needs, even indirectly, can contribute significantly to overall healing and peace. This requires a sensitive, integrated perspective. The challenge of integrating conflicting information or ambiguous symptoms requires a high level of critical discernment and professional confidence. Nurses must weigh competing data points, consult various sources, and often rely on their integrated clinical judgment to navigate uncertainty. This is a common occurrence in practice. The development of an integrated care plan represents the tangible outcome of this complex process, outlining a holistic strategy for patient well-being. It articulates how various interventions, across different domains, will work synergistically to achieve desired outcomes. This plan is a living document. The nurse's internal conceptual map functions as an integrated system, constantly being updated and refined with each new patient encounter and learning experience. This mental framework allows for rapid assimilation of new information and its connection to existing knowledge. It guides intuitive understanding. The connection of integration to professional identity is profound, as the ability to synthesize diverse knowledge defines the unique role of the nurse. It distinguishes nursing from other health professions, emphasizing its holistic and relational approach. This forms a core aspect of professional self-concept. The role of empathy in facilitating the integration of patient experience cannot be overstated, as it allows the nurse to truly understand the patient's perspective. By stepping into another's shoes, the nurse can better connect the dots between symptoms, feelings, and life circumstances. This humanizes the data. The continuous refinement of integrated knowledge is an unending journey, driven by curiosity, ethical commitment, and a desire for excellence. Each case presents an opportunity to deepen understanding and strengthen the connections between theory and practice. This iterative process ensures ongoing growth. The link between integrated understanding and patient advocacy is direct and powerful, enabling nurses to speak effectively on behalf of those in their care. A comprehensive grasp of the patient's situation provides the foundation for informed and persuasive advocacy. This protects patient rights and needs. The concept of presence often embodies an integrated state, where the nurse brings their full attention, knowledge, and compassion to the patient encounter. It signifies a holistic engagement, where all aspects of the nurse's being are attuned to the needs of the moment. This is a deeply integrated act. The recognition of emergent properties from integrated data allows nurses to identify new insights or unforeseen complications that arise from the interaction of multiple factors. The whole becomes greater than the sum of its parts, revealing patterns not visible in isolated data. This requires synthetic thinking. The responsibility of the nurse in maintaining coherence within the complex healthcare system is substantial, acting as a vital link between various providers and patient needs. They ensure that information flows effectively and that care remains aligned with holistic goals. This stewardship is critical. The ongoing dialogue between theory and practice serves as a crucial mechanism for strengthening integration, continually testing abstract concepts against real-world scenarios. This dynamic exchange refines theoretical models and informs practical application. It fosters a robust knowledge base. Thus, the coherence of knowledge in nursing emerges as a profound and ongoing commitment to holistic care, requiring constant intellectual and ethical engagement. This continuous pursuit of integration forms the very essence of professional nursing identity. It defines its unique contribution to human well-being, fostering a deeper, more meaningful connection between science and compassion. The practice of nursing fundamentally engages with the profound spectrum of human response, a reality that defines its intricate daily operations. It recognizes that no two individuals, even when presenting with similar conditions, will manifest identical physiological or psychological patterns. This intrinsic variability necessitates a deeply nuanced approach to care, moving beyond standardized protocols towards an individualized understanding of each patient's unique needs. Observation within nursing invariably commences with an assessment against established physiological norms, which serve as crucial reference points. A typical adult heart rate, for example, might consistently hover around 70 beats per minute, signifying a state of cardiovascular equilibrium under resting conditions. Yet, in the dynamic clinical environment, this baseline frequently shifts, illustrating the body's remarkable capacity for adaptive changes. One may readily observe a patient's heart rate fluctuate from a resting 60 beats per minute to an elevated 140 beats per minute during periods of acute stress, infection, or significant physical exertion. Similarly, core body temperature, generally maintained with precision at 37 degrees Celsius, could vary quite readily between 35 and 39 degrees Celsius. These shifts occur in response to systemic inflammation, environmental factors, or the body's own thermoregulatory efforts. Such numeric contrasts do not inherently signal pathology. Rather, they frequently represent complex adaptive mechanisms actively engaged in restoring or maintaining internal stability. The discipline studies these differences with meticulous attention, aiming to distinguish between a benign physiological adjustment and a critical deviation that warrants immediate intervention. This discerning capacity forms a cornerstone of clinical judgment. Hydration levels further demonstrate significant individual variation, ranging across wide margins of fluid balance and electrolyte concentration. A healthy individual might maintain an optimal fluid intake of approximately 2.5 liters per day, ensuring proper cellular function and waste elimination. However, a patient experiencing severe illness or dehydration could require intravenous fluids exceeding 3 liters to restore essential homeostasis. These differences underscore the body's continuous, often precarious, effort to maintain internal stability amidst various internal and external pressures. The ongoing study of these physiological differences allows nursing professionals to refine care strategies and to prevent potential errors arising from misinterpretation. Understanding the permissible range of variation empowers practitioners to anticipate needs and to tailor interventions precisely. It forms the bedrock upon which personalized care plans are meticulously constructed. Beyond these tangible physiological metrics, the human response to pain presents another profoundly complex area of variation. Challenging simplistic categorization. One patient might rate their pain at a subjective level of 3 on a 10-point scale, describing it as a dull, tolerable ache located in a specific region. Conversely, another individual, experiencing a medically comparable event, could report a pain level of 8, characterized by sharp, debilitating intensity that pervades their entire being. These differing perceptions are not merely psychological constructs, they are intricately shaped by a complex interplay of genetic predispositions, cultural background, and prior personal experiences with discomfort. The nurse must interpret these subjective reports with profound empathy and an unwavering understanding. The patient's lived experience remains the primary, undeniable determinant of their pain's severity. This necessitates a flexible, non-judgmental, and highly individualized approach to pain management, which adapts to the expressed reality of the sufferer. Similarly, the emotional responses to illness, injury, or a life-altering diagnosis vary considerably across the human population. A diagnosis that elicits quiet resignation and a stoic acceptance in one person might provoke intense anxiety, profound sadness, or even outright anger in another. These diverse emotional landscapes are profoundly influenced by individual coping mechanisms, the strength of social support networks, and personal perceptions of vulnerability and control. Nurses frequently encounter patients who manifest remarkable resilience, despite severe challenges, demonstrating an innate capacity to adapt and persevere. Others may struggle significantly with less acute conditions, finding themselves overwhelmed by emotional distress. Recognizing these diverse emotional reactions is absolutely crucial for providing holistic care that addresses not only physical needs, but also the intricate dimensions of psychological and spiritual well-being. Therapeutic communication must therefore adapt dynamically to these varied emotional states, offering comfort and validation where it is most needed. The response to medication also highlights the pervasive nature of human variation, making pharmacotherapy a delicate art as much as a science. A standard dose of a particular pharmaceutical agent might achieve the desired therapeutic effect in one patient, leading to a measurable and predictable improvement in their condition. However, another patient could exhibit an attenuated response, requiring a higher dose to achieve efficacy, or conversely, experience unexpected adverse effects at the very same dosage. Pharmacogenomics, the burgeoning field that studies how an individual's genes affect their response to drugs, increasingly illuminates the biological underpinnings of these profound differences. Factors such as metabolic rates, the activity of specific enzymes, and the sensitivity of cellular receptors all contribute significantly to how a drug is absorbed, distributed, metabolized, and ultimately excreted from the body. This means that a seemingly uniform treatment, administered with precision, may nonetheless yield highly disparate clinical outcomes across a patient population. Consider also the significant variation observed in wound healing processes, a fundamental aspect of physical recovery. A superficial laceration might heal cleanly and efficiently within 7 to 10 days for one individual, exhibiting minimal scarring and a robust regenerative response. A similar wound in another patient, perhaps complicated by underlying health conditions such as diabetes mellitus, compromised circulation, or nutritional deficiencies, might take several weeks to heal. Such delays can present significant challenges, including persistent infection, chronic inflammation, or delayed tissue regeneration. Factors such as nutritional status, chronological age, and the overall integrity of the immune system profoundly influence the body's inherent regenerative capacity. Understanding these critical variables allows nurses to tailor wound care interventions with precision, anticipating potential delays or complications based on individual patient profiles. This proactive and individualized approach to wound management is absolutely vital for promoting optimal recovery and preventing further morbidity. The concept of normal itself, within the demanding context of nursing practice, thus becomes a profoundly dynamic and expansive concept, rather than a rigidly fixed point. It encompasses a broad range of acceptable physiological values, behavioral expressions, and adaptive responses. This perspective recognizes that health is not a singular, static state, but rather a continuous, intricate negotiation of internal biological forces and external environmental pressures. This embrace of fluidity challenges simplistic, rigid definitions, fostering a more adaptable and comprehensive understanding of well-being. Yet this very unpredictability, inherent in the diverse manifestations of human health and illness, profoundly challenges the human desire for absolute certainty within a scientific discipline. It raises a compelling academic tension that variation itself may, in fact, be the true, irreducible constant of healing. The relentless pursuit of generalizable knowledge and universal principles must always contend with the irreducible, unique individuality of each patient encounter. This tension underscores the profound complexity of clinical practice. This pervasive inherent variability compels nurses to cultivate and develop acutely refined observational skills, learning to discern subtle shifts that might indicate a critical change in a patient's status. It necessitates a continuous, iterative process of meticulous assessment, judicious intervention, and rigorous re-evaluation, where care plans are not static directives, but rather living documents, perpetually adapted to the patient's evolving condition. The profound capacity to adapt swiftly and effectively to the unexpected thus emerges as a core, indispensable competency within the nursing profession. Moreover, the patient's deeply personal history and the broader social determinants of health contribute significantly to their unique response patterns and health trajectories. Factors such as socioeconomic status, access to vital resources, deeply held cultural beliefs about illness and suffering, and past experiences with the healthcare system all profoundly shape how an individual perceives, interprets, and ultimately reacts to their current health state. These multifaceted factors introduce layers of complexity that extend far beyond pure physiological considerations. A patient from a collectivist culture, for instance, might instinctively prioritize family input and communal consensus in healthcare decision-making, a stance that could contrast sharply with an individual from an individualistic background who prefers autonomous choices and personal agency. Recognizing and respecting these profound cultural variations is paramount for providing truly respectful, effective, and culturally congruent care that genuinely aligns with patient values and societal norms. This cultivated cultural competence is an absolutely essential aspect of fundamental nursing practice. The manifestations of chronic disease also vary widely, even among individuals sharing the same diagnostic category, further illustrating the spectrum of human response. Two individuals diagnosed with congestive heart failure, for example, might present with vastly different symptom severities, distinct responses to diuretic therapies, and divergent trajectories of either gradual decline or surprising stability. Managing these complex long-term conditions, therefore, demands highly personalized and adaptable strategies that acknowledge these individual differences. These long-term variations necessitate ongoing patient education that is tailored to individual learning styles and collaborative goal setting, empowering individuals to actively manage their own health within their unique circumstances. The nurse often functions as a knowledgeable guide, helping patients navigate the intricate complexities of their chronic condition over extended periods. This partnership approach profoundly acknowledges and respects individual autonomy and agency in health management. In the realm of mental health, the spectrum of human response is perhaps most overtly and profoundly apparent, presenting immense challenges and opportunities for care. Conditions such as anxiety, depression, and other psychological states manifest with immense diversity in their specific symptoms, underlying triggers, and overall impact on daily functioning and quality of life. A single diagnostic label often encompasses a multitude of individual experiences, each with its own unique narrative and presentation. Therapeutic interventions in mental health must therefore be highly tailored, recognizing that what proves profoundly effective for one person may not resonate or be beneficial for another. The nurse engaged in mental health care engages in careful, empathetic listening and astute observation to understand the specific contours of each patient's internal world. This personalized and deeply engaged approach is absolutely critical for fostering genuine recovery and promoting mental well-being. The remarkable ability of the human body to compensate for illness or injury also varies dramatically across individuals, often influencing the perceived urgency of clinical situations. One patient might maintain relatively stable vital signs, despite significant internal pathology, subtly masking the true severity of their underlying condition. Another might decompensate rapidly and unexpectedly from a seemingly minor insult, exhibiting pronounced physiological distress and rapid deterioration. This compensatory capacity profoundly influences the timing and urgency of nursing interventions, requiring practitioners to be acutely vigilant for both overt and subtle signs of deterioration or improvement. Understanding an individual's baseline physiological state and their typical adaptive responses helps immensely in accurately interpreting these complex compensatory mechanisms. The profound art of nursing often lies precisely in discerning these critical, subtle nuances. Furthermore, the response to therapeutic communication itself is subject to considerable and often unpredictable variation. A reassuring tone and gentle demeanor that effectively calms one patient might inadvertently create a sense of distance or even mistrust for another individual who prefers direct, factual information delivered concisely. Effective communication, therefore, demands continuous adaptation to the patient's perceived needs, cultural background, and individual communication style. Building genuine rapport, consequently, involves a flexible and intuitive understanding of complex interpersonal dynamics. The nurse must be exceptionally adept at reading nonverbal cues, interpreting subtle emotional signals, and adjusting their approach to foster trust, open dialogue, and a sense of psychological safety. This profound sensitivity to individual communication preferences significantly enhances the therapeutic relationship and improves patient outcomes. Even the fundamental process of learning and adhering to health instructions varies significantly among patients, impacting the effectiveness of care. Factors such as literacy levels, inherent cognitive abilities, motivational states, and perceived self-efficacy all profoundly influence a patient's capacity to comprehend, retain, and consistently follow medical advice. What might seem straightforward and easily understood to one person could be overwhelming, confusing, or even impossible for another. Nurses must therefore employ a diverse array of teaching strategies, ranging from simple visual aids and demonstrations to simplified language and repeated instruction, to ensure that vital health information is both accessible and actionable for every single patient. This unwavering commitment to individualized patient education is absolutely fundamental to promoting effective self-care, preventing readmissions, and empowering individuals to manage their own health. It profoundly acknowledges the broad spectrum of human cognitive and learning styles. The cumulative effect of these myriad variations underscores a central, undeniable tenet of nursing practice. The patient is never merely a collection of symptoms, a diagnostic label, or an abstract case study. Each individual represents an intricate, dynamic system of interconnected physiological, psychological, social, and spiritual dimensions, constantly in a state of flux and adaptation. This holistic, person-centered view is absolutely paramount for providing truly comprehensive and compassionate care. Therefore, the discipline of nursing does not seek to eliminate or suppress variation, but rather to understand its intricate patterns, its underlying mechanisms, and its profound implications for effective care delivery. It embraces the inherent complexity in human biology and lived experience, recognizing that true mastery and clinical excellence lie not in rigidly controlling these diverse responses, but in skillfully adapting to them. This profound acceptance of complexity forms an essential foundation for ethical and patient-centered practice. The continuous interplay between expected norms and observed deviations profoundly enriches the nursing profession, elevating it beyond mere technical skill. It transforms each patient encounter into a unique and invaluable learning opportunity, perpetually expanding the collective knowledge base regarding human health, illness, and the intricate art of healing. This iterative process of learning from individual cases, observing subtle differences, and refining approaches continuously strengthens the discipline as a whole. Ultimately, the inherent variation within human response defines the very essence of personalized, patient-centered care. It compels practitioners to approach each patient with an open mind, a curious spirit, and a readiness to meticulously observe, thoughtfully interpret, and compassionately respond to their unique manifestations of health and disease. This unwavering dedication to individual specificity and uniqueness is a defining hallmark of truly compassionate and effective nursing. In this light, the profound spectrum of human response is not merely a challenge to be overcome or a problem to be solved, but rather a fundamental, beautiful characteristic of life itself, to be deeply understood and profoundly respected. It invites a continuous, meditative inquiry into the myriad ways life expresses itself through the intricate dance of health and illness, adaptation and vulnerability. This reflective stance fosters profound professional growth and a deeper appreciation for humanity. The recognition of this pervasive variation cultivates a deep and abiding humility within the practice of nursing. It gently reminds one that despite extensive training, vast knowledge, and advanced technological aids, the human body and mind retain an astonishing capacity for unique expression, unpredictable pathways, and profound resilience. This inherent humility grounds the nurse in a posture of perpetual learning, open-mindedness, and compassionate inquiry. Thus, the study of variation in nursing moves far beyond mere statistical data points to encompass a broader philosophical appreciation for life's inherent diversity and the intricate beauty of individual existence. It suggests that in the nuanced differences between individuals, in the subtle shifts and unique adaptations, one may indeed find the deepest insights into the profound art and rigorous science of healing. This understanding forms a quiet yet profound acceptance of the boundless complexity that defines human health and illness. Within the realm of nursing fundamentals, the concept of variation stands as a testament to the dynamic nature of human physiology. While general parameters define what is often considered typical, the individual expression of health and illness frequently diverges from these established norms. Understanding these deviations, rather than simply labeling them as abnormal, allows for a more nuanced and patient-centered approach to care. It is in these exceptions that the true flexibility of biological systems often reveals itself. A baseline pulse rate of 70 beats per minute, for instance, might be considered typical for an adult at rest. However, a trained nurse recognizes that a rate of 55 beats per minute in a conditioned athlete or 95 beats per minute in an individual experiencing acute stress could both fall within a functionally appropriate range for that specific context. These are not necessarily pathological states, but rather expressions of physiological adaptability. The capacity for such divergence underscores the need for individualized assessment. Physiological fluctuations represent a common form of variation, where measurements shift within a healthy spectrum over time. Blood pressure, for example, rarely remains static. A typical reading might be 120/80/10 mmHg, yet transient increases to 140/90 mmHg after moderate exertion or during periods of mild anxiety are often temporary variations not indicative of sustained hypertension. Similarly, body temperature can oscillate slightly throughout the day, with a morning reading of 36.5 degrees Celsius, potentially rising to 37.2 degrees Celsius in the late afternoon, without signifying a febrile state. These subtle shifts demand careful observation to distinguish benign variability from concerning trends. Individual responses to therapeutic interventions also highlight significant variations. A standard dosage for pain relief might be 5 milligrams of a particular medication, yet one patient might achieve adequate comfort with only 3 milligrams, while another may require 7 milligrams to experience the same therapeutic effect. Such differences often stem from unique metabolic pathways, genetic predispositions, or individual pain thresholds. Recognizing these personal variances is crucial for effective and safe medication management, ensuring that treatment is tailored to the individual rather than applied uniformly. The manifestation of symptoms can likewise vary profoundly among individuals, even when experiencing the same underlying condition. A fever, for example, might present as a temperature of 38.5 degrees Celsius, but the associated symptoms, such as chills, body aches, or diaphoresis, can differ greatly in their intensity and timing from one person to another. One individual might experience profound weakness, while another maintains a relatively high energy level, despite a similar core temperature elevation. These diverse presentations necessitate a comprehensive assessment beyond mere numerical readings, emphasizing the qualitative aspects of patient experience. Developmental stages introduce another layer of expected variation. What is considered normal for an infant often deviates significantly from adult parameters. A newborn's heart rate, which might typically range from 120 to 160 beats per minute, would be a cause for concern in an adult. Similarly, a typical newborn might feed every 3 hours, consuming approximately 60 milliliters per feeding. But some healthy infants may feed every 2 hours or every 4, with varying intake volumes, all within a healthy developmental range. These age-specific norms require distinct interpretive frameworks in nursing practice. Environmental and lifestyle factors further contribute to physiological variations. An individual accustomed to high-altitude living might naturally exhibit a slightly higher red blood cell count or a different respiratory pattern compared to someone residing at sea level. Dietary habits, physical activity levels, and even sleep hygiene can subtly alter baseline physiological measurements. These external influences shape an individual's normal parameters, making it essential for nurses to consider the patient's context when interpreting data. Adaptive variations represent the body's compensatory mechanisms in response to stress or change. For instance, in a patient experiencing mild dehydration, the body might increase heart rate or constrict peripheral blood vessels to maintain core circulation, leading to a blood pressure reading that, while within a broad normal range, is slightly elevated from their personal baseline. These subtle compensations are critical indicators that the body is actively working to restore balance. Observing these adaptive shifts allows for early intervention before a minor variation escalates into a significant imbalance. One academic tension arises from the inherent individuality of human physiology, which means that predicting the precise trajectory of these variations remains a complex challenge. While statistical models can offer probabilities, the unique interplay of genetic, environmental, and behavioral factors makes absolute certainty elusive. The act of measuring itself might subtly alter the observed phenomenon, as patient anxiety or discomfort can influence physiological responses, adding another layer of interpretive complexity. Ultimately, the recognition of such variations underscores the dynamic nature of health and the nuanced art of nursing observation. It is through this appreciation of the exception alongside the rule that nursing practice achieves its depth, moving beyond mere adherence to averages to embrace the full spectrum of human experience. The calm acceptance of this complexity allows for more compassionate and effective care. The transformation of raw observation into meaningful insight represents a fundamental act within the sphere of nursing fundamentals. It is the sophisticated process through which discrete measurements and reported sensations transcend their isolated forms to coalesce into a coherent and actionable narrative. This profound conversion bridges the quantitative realm of what is meticulously measured with the qualitative experience of what is genuinely felt by the individual, creating a vital link in understanding. One may therefore consider interpretation as the essential bridge, allowing the subtle language of data to speak clearly in a form understandable to human comprehension and clinical application. Patterns observed in vital signs, such as a patient's temperature, pulse, or respiratory rate, are not merely numerical representations. They constitute a profound form of communication, emanating directly from the body itself. A subtle yet persistent elevation in core body temperature, for instance, might be interpreted not just as a numerical deviation from a baseline, but as an early and critical indicator of an inflammatory response, or the insidious onset of a systemic infection. The nuanced act of interpretation thus requires a careful and deliberate synthesis of these individual data points into a larger, more comprehensive picture of the patient's intricate physiological status, moving beyond simple recognition to a profound and empathetic comprehension of underlying processes. Meaning arises from analysis, when these meticulously collected observations are contextualized within established and robust frameworks of scientific and theoretical knowledge. Nursing fundamentals provide the indispensable theoretical lens through which these observed patterns gain their deepest significance and clinical relevance. For example, a sustained rapid heart rate, perhaps consistently registering at ***110 beats per minute, when viewed critically against a typical and healthy resting rate of **70 beats per minute strongly suggests a significant physiological stressor, much like a complex orchestral piece played at an unexpectedly accelerated tempo. This crucial analytical step effectively connects the observed physiological phenomenon to its potential underlying causes and its broader implications for patient well-being and recovery. The intricate process of interpretation involves discerning subtle yet critical relationships between seemingly disparate pieces of information that might initially appear unrelated. A skilled nurse might meticulously note a patient's increased breathlessness, a faint and subtle cyanosis around the lips, and a consistently reported feeling of profound anxiety. Individually, each of these observations could potentially point to various distinct issues, but when interpreted together through an experienced lens, they might strongly suggest an impending cardiac or respiratory compromise requiring urgent attention. This holistic and integrated understanding is absolutely critical, as it allows for the informed formulation of appropriate and timely nursing interventions that address the patient's complex needs. It is a continuous and iterative loop of diligent data gathering, precise pattern recognition, and insightful conceptual linkage. Understanding also profoundly emerges from the dynamic interplay between objective, measurable data and the rich, subjective patient experience that gives context to their condition. A patient's verbal description of pain, for instance, cannot be directly measured with the same quantitative precision as blood pressure. Yet its compassionate interpretation is equally, if not more, vital to effective care. The nurse must meticulously integrate the patient's self-report with observable physical signs of discomfort, such as subtle grimacing, protective guarding, or restless movements, to form a complete and empathetic assessment. This crucial integration transforms raw, impersonal data into a deeply human-centered understanding, recognizing the inherent and undeniable subjectivity of illness and suffering. The act of interpretation, while conscientiously striving for absolute objectivity, inherently carries the indelible imprint of the interpreter's unique perspective and background. One's prior clinical experiences, accumulated theoretical knowledge, and even subtle subconscious biases tend to significantly shape how evidence is initially perceived, prioritized, and ultimately understood. This presents a profound academic tension. The understanding of evidence may always be partially influenced by the specific and individual lens through which it is viewed, creating an intricate and often challenging dance between objective, verifiable fact and subjective, nuanced perception. This critical awareness necessitates a continuous and rigorous process of critical self-reflection and intellectual humility within clinical practice. A slight but concerning variation in blood pressure, perhaps a **** 15 mmHg *** drop in systolic pressure from a patient's established baseline, might be interpreted quite differently depending on the patient's overall health status, their individual baseline, and their comprehensive clinical history. This contextual understanding is much like how a subtle shift in a musical score might profoundly alter the entire emotional tone and meaning of a complex symphonic piece. The rich context provided by the individual patient's unique physiological and psychosocial landscape becomes absolutely paramount in shaping the accurate and relevant interpretation of these numerical values. Without this deep contextual understanding, data risks remaining merely abstract numbers, unfortunately devoid of deeper clinical relevance and meaning. The profound sensitivity to human context is a foundational cornerstone of effective and compassionate interpretation in nursing practice. It means conscientiously recognizing that a patient's cultural background, deeply held personal beliefs, and current emotional state can significantly influence their presentation of symptoms, their willingness to communicate, and their overall response to care and treatment. For instance, a patient's apparent reluctance to describe their pain in explicit detail might be interpreted not as an absence of pain, but rather as a deeply ingrained cultural norm of stoicism, or a desire not to burden others. Such nuanced and empathetic understanding moves far beyond purely logical deduction, embracing the full spectrum of human experience. The interpreter inevitably brings their own set of assumptions to the bedside, influencing the initial hypotheses and diagnostic pathways formed about a patient's condition. These assumptions, while sometimes proving helpful in efficiently guiding initial inquiry and focusing attention, can also inadvertently narrow the comprehensive scope of interpretation, potentially overlooking alternative and equally valid explanations. It therefore becomes critically important for the nurse to actively challenge these initial perceptions, to critically evaluate their own biases, and to remain genuinely open to new, potentially contradictory evidence that might emerge. This intellectual humility and openness to revision is a vital and non-negotiable component of sound and ethical clinical judgment. The dynamic process of converting raw observation into profound meaning is therefore inherently relational, embodying a continuous and evolving dialogue between the empirical data that meticulously gathered and the multifaceted human element involved in both providing and receiving care. It is a dynamic and reciprocal exchange, where the body's often silent and subtle language is skillfully translated through the nurse's educated perception, critical reasoning, and empathetic understanding. This ongoing dialogue continually refines initial interpretations, leading to more accurate, comprehensive, and ultimately more compassionate care strategies that truly meet the patient's individual needs. The depth of understanding evidence in nursing fundamentals extends significantly beyond mere identification of existing problems. It encompasses the critical anticipation of potential future trajectories and complications. Interpreting a consistent trend of gradually declining oxygen saturation levels, for example, allows the astute nurse to foresee impending respiratory distress or failure, thereby enabling proactive and preventative interventions rather than merely reactive responses to an acute crisis. This crucial foresight is a direct and invaluable product of skilled interpretive reasoning, grounding all future actions firmly in current, carefully observed data and trends. When considering the profound implications of patient statements and non-verbal cues, the nurse interprets not just the explicit words spoken, but also the underlying emotions, unspoken fears, and fundamental, unmet needs. A patient expressing profound fear or apprehension about an upcoming procedure, despite having received verbal assurances and explanations, may be communicating a deeper, unaddressed anxiety that requires a different kind of therapeutic intervention and emotional support. This requires exceptional sensitivity to subtle nonverbal cues, keen observational skills, and the ability to thoughtfully read between the lines of explicit communication, thereby transforming raw observations into deeply felt and understood meaning. The accuracy and reliability of interpretation often depend heavily on the systematic and rigorous application of sound logical reasoning. Deductive logic might be judiciously employed when a specific and well-defined set of symptoms points directly and unambiguously to a known diagnosis or a well-established pathological condition. Inductive reasoning, conversely, might be thoughtfully utilized when piecing together disparate and seemingly unrelated observations to form a novel hypothesis or a comprehensive understanding about an unusual or atypical patient presentation. Both forms of logical reasoning are absolutely integral to constructing a robust, defensible, and clinically relevant interpretive framework within advanced nursing practice. However, the undeniable human element ensures that interpretation is never purely a mechanical or algorithmic application of logic. There is always an intuitive component, an informed and educated gut feeling that arises organically from extensive clinical experience, repeated exposure to complex and varied clinical scenarios, and the development of expert pattern recognition. This clinical intuition, while not always easily articulable or consciously reasoned, often subtly guides the nurse towards critical observations or essential lines of inquiry that might otherwise be inadvertently overlooked. It represents a sophisticated form of holistic pattern recognition that often transcends purely conscious, step-by-step, logical thought processes. The understanding of evidence in nursing fundamentals is thus a multifaceted and highly sophisticated skill, seamlessly blending rigorous scientific knowledge with profound humanistic sensitivity and empathy. It demands an inherent ability to perceive the individual patient not merely as a collection of isolated symptoms or a diagnostic label, but rather as a whole and unique person whose life experiences, beliefs, and emotional states profoundly inform and shape their physiological responses and overall health trajectory. This integrated and holistic perspective is precisely what allows for truly personalized, effective, and deeply compassionate care delivery that respects the patient's individuality. The intricate language of the human body, expressed through the myriad forms of vital signs, physical manifestations, and subjective reports, requires a highly skilled and perceptive interpreter to accurately translate its nuanced and often subtle messages. A patient's skin turgor, for instance, might provide a critical indicator of their hydration status. A subtle and unexplained change in skin color could signify altered tissue perfusion or an underlying circulatory issue. Learning to meticulously read and interpret these diverse physical signs is a core competency in nursing, effectively transforming visual, tactile, and auditory observations into meaningful and actionable clinical data that informs care decisions. Furthermore, the sophisticated interpretation of evidence often involves a crucial comparative analysis, meticulously benchmarking current observations against established physiological norms, or, more importantly, against the patient's individual and documented baseline. A blood pressure reading of **** 13085 mmHg ***, while generally considered within a broad healthy range for the general population, might be a significant and concerning finding for a patient whose usual documented baseline is consistently asterisk, asterisk, 9060 mmHg, asterisk, asterisk, potentially indicating a sudden and problematic elevation requiring further investigation. This critical comparative lens adds immense depth and precision to numerical interpretation, tailoring it to the individual. The entire interpretive process is not static or rigidly fixed, but rather inherently adaptive and dynamic, continuously evolving as new clinical information becomes available, as diagnostic tests are completed, or as the patient's condition changes and responds to interventions. An initial interpretation, however carefully formed, might be revised or completely re-evaluated as further diagnostic data is obtained, or as the patient's unique response to prescribed interventions is meticulously observed and documented. This dynamic and iterative nature of understanding requires constant vigilance, intellectual flexibility, and a genuine willingness to adjust one's perspective in light of compelling new evidence. The academic tension between objective, quantifiable evidence and subjective, lived perception highlights the profound challenge and immense responsibility inherent in the act of clinical interpretation. While a numerical value, such as a laboratory result or a vital sign, provides a concrete and verifiable data point, its true and complete meaning is often profoundly shaped by the intricate context of the individual patient's life, their unique illness experience, and their personal circumstances. Reconciling and harmonizing these two distinct yet interconnected domains, the objective and the subjective, is a continuous and demanding endeavor for the highly skilled nursing professional, forming the very essence of patient-centered care. Ultimately, interpretation within the broad domain of nursing fundamentals is the indispensable act of transforming raw, often fragmented data into coherent, actionable, and deeply meaningful knowledge. It skillfully bridges the critical gap between what is observed through the senses and what must be thoughtfully and effectively done to promote healing and well-being. This profound synthesis of empirical evidence and insightful understanding forms the unwavering bedrock of all sound clinical decision-making, meticulously guiding the nurse in providing thoughtful, effective, and profoundly compassionate care that truly honors the patient's journey. The continuous and evolving dialogue between objective data and profound humanity thus continues, shaping the very essence of comprehensive patient understanding and ethical practice. The profound understanding cultivated through the study of nursing fundamentals extends its intricate reach far beyond the immediate, often sterile, clinical environments of hospitals and other healthcare facilities, permeating deeply into complex moral and broader societal realms. This foundational body of knowledge, meticulously acquired, rigorously tested, and continuously refined through practice and scholarly inquiry, confers a significant and inescapable responsibility upon those who choose to engage in its professional application. It is observed that each deliberate act of care, from the most seemingly routine procedural task to the most critically urgent intervention, inherently reflects a nuanced and often challenging tapestry of professional judgment, ethical consideration, and a deep sense of accountability. It could be said that the consistent application of core nursing principles becomes a quiet, yet profoundly powerful declaration of underlying humanistic values, subtly yet significantly influencing the very fabric of community health, individual well-being, and the collective societal perception of care. This inherent responsibility necessitates a constant vigilance in decision-making where theoretical knowledge from nursing fundamentals is seamlessly integrated with practical wisdom and an acute awareness of the patient's unique circumstances. The implications of such informed judgment ripple through every aspect of care, shaping outcomes that extend beyond physical recovery to encompass emotional and psychological restoration. One may consider that the moral weight of these daily decisions underscores the critical importance of a robust education in fundamental nursing principles, providing a stable ethical compass in often turbulent situations. The discipline of nursing fundamentals, therefore, carries a substantial and often underestimated weight in shaping the pursuit of health equity, an aspirational ideal, striving to ensure that high-quality, comprehensive care is both genuinely accessible and justly distributed among all individuals within a given population. It tends to appear that pervasive disparities in health outcomes, frequently observed across diverse socio-economic strata, racial groups, and geographic locations, often originate from deep-seated systemic inequities rather than individual failings. Nursing practice, informed by its fundamental tenets of holistic care and social justice, is uniquely positioned to actively address these imbalances through dedicated advocacy, compassionate direct intervention, and a steadfast commitment to culturally sensitive and appropriate care delivery models. One may observe that the equitable distribution of essential care resources, coupled with informed, empathetic attention and respect for diverse belief systems, transcends mere professional duty to become a profound and non-negotiable moral imperative, deeply embedded within the comprehensive nursing framework. This commitment to health equity necessitates a constant and evolving awareness of the intricate social determinants of health, compelling practitioners to understand how a myriad of factors, such as socioeconomic status, educational attainment, housing stability, geographic location, and prevailing cultural background, profoundly influence individual patient needs and their overall health trajectories. Nursing fundamentals teaches one to look far beyond the immediate presentation of symptoms, recognizing the broader, often invisible, context that shapes an individual's health journey and their access to supportive health systems. It seems that a truly equitable approach demands an active and sustained engagement with community resources, a willingness to challenge institutional barriers to care, and a proactive stance in advocating for vulnerable populations, thereby ensuring that the principles of justice are rigorously upheld in every single interaction and policy recommendation. The long-term impact of such a comprehensive and justice-oriented approach can be observed in demonstrably improved community health metrics, where the diligent and ethical application of fundamental nursing principles contributes significantly to fostering a more just, healthier, and resilient populace, reducing preventable suffering and promoting collective flourishing. Furthermore, the intricate ethics of intervention constitute a critically important, frequently challenging, and often nuanced component of nursing fundamentals, guiding practitioners through moments demanding delicate, time-sensitive, and sometimes profoundly difficult decision-making processes. These interventions span a vast and diverse spectrum, ranging from the provision of the most basic supportive care, designed primarily to comfort, alleviate discomfort, and sustain life, to the meticulous execution of complex, technologically advanced, and often life-sustaining medical measures. Each distinct intervention, regardless of its inherent scale, demands a sophisticated and nuanced understanding of patient autonomy, ensuring that individual preferences, values, and expressed wishes are consistently respected and honored. This must occur alongside the unwavering application of the principle of beneficence, which ethically guides all actions toward achieving the patient's best interests while simultaneously avoiding maleficence. It appears that the ethical landscape of nursing necessitates a continuous, thoughtful, and often introspective re-evaluation of what truly constitutes appropriate, effective, and profoundly compassionate action in an ever-evolving array of diverse, unpredictable, and often challenging clinical circumstances. The ethical framework within nursing fundamentals also encompasses the concept of non-maleficence, ensuring that no harm is intentionally caused, and fidelity, which speaks to the commitment to keep promises and maintain trust with patients. These principles are not abstract ideals, but practical guides for daily decisions, from medication administration to end-of-life discussions. One may consider that the integration of these ethical considerations transforms technical skills into acts of moral significance, where every action is weighed against its potential impact on the patient's well-being and autonomy. This continuous ethical deliberation becomes a hallmark of professional nursing practice, ensuring care is not only effective, but also morally sound. The preservation of individual dignity stands as an unshakable and non-negotiable cornerstone implication of nursing fundamentals, profoundly emphasizing the intrinsic and inherent worth of every single person, irrespective of their current health status, their level of physical or emotional vulnerability, or their societal standing. This crucial and deeply humanistic aspect of care involves not only the meticulous and respectful provision of physical care, ensuring patient comfort, hygiene, and safety, but also extends profoundly to the diligent protection of emotional integrity, the safeguarding of personal privacy, and the unwavering respect for the patient's remaining sense of personal agency and self-determination. This unwavering commitment to dignity holds true even, and perhaps especially, when individuals find themselves in states where they are severely incapacitated, unable to clearly articulate or actively advocate for their own needs, preferences, or desires. One might argue that upholding and actively preserving dignity is not merely a professional expectation or a set of guidelines to be followed, but rather a fundamental and inalienable human right that is deeply embedded within the very ethos, theoretical underpinnings, and practical application of nursing. Maintaining this profound sense of dignity often involves subtle yet extraordinarily powerful acts, such as ensuring complete privacy during personal care routines, listening attentively and without judgment to patient concerns and fears, and actively involving patients in decisions about their treatment plans whenever their capacity allows. Nursing fundamentals meticulously trains one to recognize the often unspoken, non-verbal cues of distress, discomfort, or fear, thereby enabling timely and appropriate interventions that serve to preserve self-respect and foster a crucial sense of control for the patient. It tends to appear that the compassionate and respectful manner in which care is delivered can be as profoundly impactful as the specific medical care itself, significantly shaping a patient's entire experience of illness, recovery, and even end-of-life transitions. The consistent and thoughtful application of these dignity-preserving principles contributes immeasurably to creating healing environments where individuals feel genuinely respected, valued, and seen as whole persons, even amidst the most significant and debilitating health challenges. It is of paramount importance to note that precision in the application of nursing fundamentals, while undeniably essential for achieving optimal clinical efficacy, ensuring paramount patient safety, and adhering to evidence-based practices inherently risks fostering a significant ethical imbalance if it is not consistently tempered by genuine, active, and deeply human empathy. A purely technical or mechanistic approach to care, one that focuses exclusively on the efficient completion of tasks and adherence to rigid procedures, while being largely devoid of authentic human connection and compassionate understanding, may indeed achieve specific, measurable clinical outcomes. However, such an approach could inadvertently diminish or even profoundly negate the patient's holistic experience of care, reducing them to a mere collection of symptoms, a diagnosis, or a set of physiological data points, rather than recognizing their full and complex personhood. This critical observation strongly suggests that the profound art of nursing lies in achieving a delicate, dynamic, and harmonious blend of rigorous scientific knowledge, precise technical skill, and compassionate human understanding, thereby preventing the critical act of care from devolving into a cold, impersonal, potentially dehumanizing process that undermines the very essence of healing. The inherent tension between the necessity of precision and the imperative of empathy is not one that can be easily or definitively resolved, requiring instead a constant, mindful, and reflective engagement from the nursing professional. One may observe that an over-reliance on standardized protocols and rigid guidelines without adequately considering the unique individual patient context can often lead to a form of care that feels depersonalized and standardized rather than truly individualized and responsive. Conversely, it must be acknowledged that a lack of precision, however well-intentioned or empathetic, could gravely compromise patient safety, treatment effectiveness, and ultimately lead to adverse outcomes. The principles of nursing fundamentals therefore actively encourage a dynamic and continuous interplay where evidence-based practice and scientific rigor are always filtered through a lens of humanistic concern, ensuring that both the exacting science and the compassionate art of nursing are given their due and equal importance in every single patient encounter. This delicate balance becomes a continuous area of professional growth and ethical introspection. The academic tension here lies precisely and profoundly between the imperative for operational efficiency, often driven by economic and systemic pressures within the complex landscape of modern healthcare delivery, and the undeniable, irreducible necessity of humanity, compassion, and individualized attention in all patient interactions. While contemporary healthcare systems are frequently designed and optimized to prioritize swiftness, cost-effectiveness, and the most optimal allocation of finite resources, the foundational principles of nursing fundamentals serve as a powerful, persistent, and often countercultural reminder that authentic human connection, profound compassion, and truly individualized attention cannot be easily quantified, efficiently streamlined, or ethically depersonalized, without the potential for significant, detrimental, and often irreversible loss to the patient and the integrity of care. This inherent and persistent conflict between the demands of systematic efficiency and the profound requirements of human-centered care demands a continuous, thoughtful, and often challenging navigation by nursing professionals to ensure that neither critical aspect is entirely sacrificed or unduly diminished for the sake of the other, maintaining a delicate equilibrium. Navigating this complex tension requires a deep and comprehensive understanding of organizational dynamics, policy implications, and resource management, alongside an unwavering and steadfast commitment to patient advocacy and ethical practice. Nursing professionals, grounded firmly in their fundamentals, often find themselves positioned at the critical intersection of these competing demands, constantly seeking innovative and creative ways to deliver care that is both highly efficient and profoundly human. It appears that the ability to balance these powerful forces effectively is a distinguishing hallmark of advanced and ethically mature nursing practice, where systemic pressures are acknowledged and understood, but are never allowed to completely overshadow the individual patient's unique needs, preferences, and inherent dignity. This continuous balancing act becomes an ongoing ethical exercise, profoundly shaping daily practice, influencing institutional policies, and informing long-term strategic planning within healthcare organizations, ensuring that the human element remains central. Every significant advancement within the expansive and ever-evolving field of nursing fundamentals, whether it manifests as a groundbreaking new procedural technique, the introduction of an innovative pharmacological treatment, the development of sophisticated diagnostic tools, or the formulation of a revolutionary model of care delivery, must inherently carry a measure of profound humility that is precisely equal to its considerable inherent power. The capacity to intervene so directly and significantly in human lives, to effectively alleviate profound suffering, to skillfully promote healing, to restore function, and to extend life itself, represents an immense and transformative power that few professions wield. Yet, this formidable power must always be wielded with an acute and constant awareness of its inherent limits, its potential for unforeseen and unintended consequences, and the profound ethical responsibility it perpetually entails. It could be said that true and meaningful progress in nursing is not solely marked by what can be technically achieved or scientifically understood, but rather, and perhaps more importantly, by the wisdom to discern precisely how and when such powerful interventions should be judiciously applied, always maintaining a deep, abiding, and respectful reverence for the individual human being at the very center of all care. This essential humility acknowledges that despite all accumulated knowledge, technological prowess, and scientific advancements, the human experience of illness, suffering, and healing remains deeply personal, often unpredictable, and inherently complex. Nursing fundamentals instills the profound understanding that while science provides the indispensable tools and theoretical frameworks, true and holistic care requires an unwavering recognition of both human vulnerability and remarkable human resilience. It tends to appear that an attitude of genuine humility fosters an open willingness to continuously learn from patients, to adapt care approaches based on individual responses and evolving needs, and to continually refine professional practice based on real-world outcomes, rather than rigid, unthinking adherence to protocols. This reflective and adaptive stance ensures that power is exercised with grace, ethical discernment, and a constant, vigilant awareness of the profound moral implications of every single action taken within the nursing domain. The profound and multifaceted responsibility inherent in the practice of nursing fundamentals thus extends far beyond mere technical competence or the skillful execution of prescribed tasks, encompassing a comprehensive and deeply rooted moral obligation to meticulously consider the broader, often subtle, yet far-reaching impact of care on both individual patients and the wider societal context. It tends to appear that the constant, dynamic, and often challenging interplay between acquired knowledge, acute ethical judgment, and an unwavering commitment to the preservation of human dignity forms the very essence and enduring core of this vital and continuously evolving discipline. This continuous process of critical reflection, ethical evaluation, and engaged self-assessment ensures that nursing remains a profoundly human endeavor, ever adapting to new scientific discoveries and societal challenges, yet firmly anchored in its timeless ethical foundations and its core dedication to compassionate, holistic, and responsible service. The implications of this comprehensive ethical framework resonate across all levels of human experience, profoundly shaping health and well-being in ways that are both immediately impactful and enduringly significant for generations. The foundational knowledge within nursing fundamentals intrinsically links to profound human and ethical implications. One may observe that the very essence of caregiving, often resides in navigating a landscape of inherent contradictions. This dual nature requires a constant oscillation between seemingly opposing forces, shaping the moral and experiential dimensions of the profession. The understanding of these paradoxes illuminates the complex responsibilities placed upon those who heal. It appears that the nurse must consistently bridge the chasm between scientific objectivity and compassionate engagement. Clinical decisions, often rooted in empirical data and evidence-based protocols, require a detached, analytical perspective. Yet, simultaneously, the suffering individual demands a tender presence, an empathetic resonance that acknowledges their unique human experience. This necessitates a fluid transition between the precise application of knowledge and the intuitive offering of comfort. The ethical landscape of nursing is thus defined by this perpetual balancing act. A nurse might approach a complex medical condition with rigorous scientific inquiry, meticulously assessing symptoms and implementing interventions. Concurrently, the same individual must offer solace, listen to anxieties, and provide reassurance, often without explicit instruction. This interplay suggests that effective care emerges from the skillful integration of both the measurable and the immeasurable aspects of human need. The implications extend to the very identity of the nursing professional. One could argue that the strength of the profession arises precisely from its capacity to embody these contrasting virtues. The nurse is expected to be both a dispassionate observer of physiological processes and a deeply engaged advocate for human dignity. This dual role shapes not only daily practice, but also the broader societal perception of what it means to provide care. Maintaining a professional distance while fostering genuine human connection presents a significant ethical challenge. Detachment may be necessary to make difficult decisions or to endure emotionally taxing situations without succumbing to burnout. However, an absence of empathy could diminish the quality of care, leaving patients feeling unheard or dehumanized. The optimal point between these poles often remains elusive, demanding constant ethical reflection. The human element of nursing fundamentally depends on this delicate equilibrium. A patient may require a precise medication dosage, a purely scientific act, yet the manner in which that medication is administered with kindness, explanation, and respect transforms the interaction. This suggests that the scientific act gains its full therapeutic potential when infused with humanistic compassion. The ethical imperative is to ensure that neither dimension overshadows the other. Societal expectations often amplify these inherent tensions. There is a collective desire for nurses to be infallible experts, capable of precise medical interventions, while simultaneously being infinitely nurturing and understanding. This dual demand can place considerable psychological strain on practitioners. It implies a responsibility to be both scientifically rigorous and emotionally resilient, embodying a comprehensive ideal of care that is challenging to sustain. The philosophical implications of this paradox are profound. It raises questions about the nature of healing itself. Is it primarily a biological repair, or does it encompass a restoration of the spirit? Nursing, through its dual nature, suggests that it is both. The profession operates at the intersection of body and mind, science and soul, continuously affirming the holistic nature of human well-being. This integrated perspective forms a central tenet of its ethical framework. Considerations of vulnerability further highlight this complexity. Patients often find themselves in states of extreme physical or emotional fragility, necessitating a caregiver who can provide both expert medical attention and profound human understanding. The nurse's ability to remain objective enough to act decisively, while empathetic enough to acknowledge suffering, becomes paramount. This requires a sophisticated ethical sensibility that develops through experience and reflection. The responsibility inherent in navigating these paradoxes demands a deep sense of humility. No single approach can perfectly resolve the tension between science and compassion, or between detachment and empathy. One might observe that the most effective care often emerges from an acknowledgement of this inherent irresolution. It calls for a continuous learning process, adapting one's approach to the unique needs of each individual and situation. The ethical commitment to patient advocacy also reflects this dual nature. Nurses are often tasked with speaking for those who cannot speak for themselves, requiring both an analytical understanding of their medical condition and an empathetic grasp of their wishes and values. This dual perspective ensures that care is not only medically sound, but also ethically aligned with the patient's autonomy and best interests. The balancing act is continuous. The constant interplay between evidence-based practice and person-centered care exemplifies this ongoing tension. While scientific evidence provides a robust foundation for interventions, individual patient preferences, cultural contexts, and personal values must also be integrated. Ignoring either dimension could lead to care that is technically proficient, but ethically or experientially lacking. This synthesis defines a core ethical challenge for the profession. It could be said that the very act of healing, in its most profound sense, requires an acceptance of this inherent duality. The nurse must engage with the concrete realities of disease and injury, applying learned skills and knowledge. Simultaneously, they must engage with the abstract realities of fear, hope, and resilience, offering a presence that transcends mere technical assistance. This integration is not simply desirable. It appears to be essential. The ethical burden of care often stems from the necessity of making decisions within this paradoxical space. There are moments when scientific protocols might suggest one course of action, while compassionate considerations point towards another. Navigating these dilemmas requires not only ethical reasoning, but also a profound understanding of human suffering and the limits of purely objective intervention. This tension defines the humanity of the profession. One might observe that the strength of nursing arises precisely from accepting the coexistence of certainty and doubt. While scientific knowledge provides a degree of certainty regarding physiological processes, the human experience of illness often introduces profound uncertainties. The nurse must operate within this liminal space, offering both assured competence and a humble acknowledgement of the unknown. This philosophical stance underpins ethical practice. The implications for professional development are also significant. Education in nursing often emphasizes both rigorous scientific training and the cultivation of empathy and ethical reasoning. This dual pedagogical approach reflects the inherent paradoxes of the field. It prepares future practitioners not only to understand disease, but also to navigate the complex moral terrain of human suffering and recovery. The integration of these skills is paramount. Ultimately, the knowledge of nursing's dual nature translates into a profound ethical responsibility to embrace complexity. It suggests that simplistic solutions or rigid adherence to one pole of the paradox will always fall short. Instead, the profession demands a dynamic, reflective approach, where scientific rigor is tempered by human compassion, and professional detachment is balanced by empathetic engagement. This ongoing commitment defines the ethical core of nursing. The philosophical underpinnings of nursing fundamentals delve into the very essence of care, moving beyond mere technical proficiency to explore its profound meaning. It is a domain where the abstract principles of human interaction meet the tangible realities of vulnerability and healing. This inquiry reflects upon the inherent duties that arise from a commitment to service, the quiet power of presence, and the enduring resilience required in the accompaniment of suffering. One might observe that this philosophical lens transforms nursing from a mere occupation into a deeply ethical vocation, demanding continuous introspection and moral fortitude from its practitioners. One may consider duty in nursing not merely as a set of prescribed tasks, but as a deeply ingrained moral obligation to uphold the well-being of another. This duty often manifests as a sustained commitment, extending beyond immediate needs into the broader trajectory of a person's health journey. It appears to be a tacit agreement, a silent pledge to stand alongside individuals during their most challenging moments. The nature of this professional duty frequently calls for a dedication that transcends personal convenience, demanding a consistent and unwavering focus on the needs of the patient. This ethical imperative to serve forms a foundational pillar, shaping every interaction and decision within the care environment, ensuring that the patient's welfare remains the paramount concern. Presence, in this context, signifies more than just physical proximity. It embodies a profound state of being with another, fully attentive and engaged. It is the quiet act of bearing witness to pain, fear, or hope, offering a steady anchor in times of uncertainty. This form of presence could be said to create a space of psychological safety, allowing individuals to feel seen and acknowledged in their unique experiences. The therapeutic power of a nurse's unwavering presence might often be underestimated, yet it forms a fundamental pillar of compassionate care, fostering trust and facilitating genuine connection. Such presence involves three critical dimensions: active listening, empathetic attunement, and a non-judgmental acceptance of the patient's reality, each contributing to a holistic understanding. The quiet endurance of service speaks to the sustained effort and often unseen resilience inherent in the nursing profession. It involves a continuous giving of self, often over long hours and through emotionally demanding situations, without expectation of immediate reward or recognition. This endurance is not passive resignation, but an active, sustained commitment to the welfare of others, often requiring significant personal fortitude. It tends to appear as a steady, unwavering light, guiding patients through their darkest hours with calm resolve and consistent support. This steadfastness embodies a profound ethical commitment, reflecting a deep-seated belief in the inherent dignity and worth of every individual receiving care. Ethics in nursing emerges as an ongoing, dynamic dialogue, constantly navigating the intricate interplay between competing moral imperatives. It is not a static set of rules, but a continuous process of reflection, deliberation, and adaptation to complex human situations. This dialogue frequently centers on the delicate balance between respecting individual autonomy and providing necessary protection. One might observe that ethical considerations are woven into the very fabric of daily practice, shaping every decision and interaction within the care environment, thereby ensuring that actions align with the highest moral standards. The principle of autonomy asserts the right of individuals to make informed decisions about their own health and future, even when those choices might seem unconventional to others. Nursing fundamentals emphasize fostering this self-determination, ensuring that patients receive comprehensive information to guide their choices. However, this commitment to autonomy often exists in tension with the professional obligation to protect individuals from harm. It could be said that the challenge lies in discerning when a choice, made freely, might inadvertently lead to significant and preventable detriment, requiring a careful ethical calibration. Protection, conversely, reflects the nurse's duty to safeguard vulnerable individuals from potential risks, whether physical, psychological, or social. This protective stance might involve advocating for patient safety, intervening in situations of potential harm, or ensuring a secure and therapeutic environment. The ethical dilemma frequently arises when a patient's autonomous desires appear to conflict with what is professionally deemed to be in their best interest. Navigating this delicate boundary requires profound ethical sensitivity and a nuanced understanding of each unique situation, often demanding a careful weighing of potential benefits against potential harms. The ongoing dialogue between choice and safety further exemplifies the complexities encountered in ethical nursing practice. Patients may express choices that, from a clinical perspective, could compromise their immediate or long-term safety. For instance, a patient might decline a recommended treatment that offers a high probability of recovery, opting instead for a path that carries greater risk. The nurse's role here is not to override choice, but to ensure that the patient's decision is truly informed, free from coercion, and reflective of their deepest values. This requires a patient-centered approach that prioritizes empathetic communication over paternalistic directives. The academic tension centers on how far guidance can go before it becomes control. This fundamental question highlights the fine line between supportive counsel and undue influence in the therapeutic relationship. Guidance aims to empower individuals by illuminating options, clarifying consequences, and facilitating informed decision-making. Control, however, implies an imposition of will, diminishing the patient's agency and potentially undermining their dignity. The ethical imperative demands that nurses continuously assess their interventions to ensure they remain within the bounds of respectful guidance, fostering independence rather than dependence. One may consider the subtle shifts in language and approach that distinguish guidance from control. Offering information and exploring alternatives constitutes guidance, while dictating a specific course of action without genuine patient input tends towards control. The aim is always to support the patient's capacity for self-governance, even when their choices diverge from professional recommendations. It appears to be a constant calibration, a sensitive attunement to the patient's voice and their right to self-determination, ensuring that the nurse acts as a facilitator, not a director. The philosophy of nursing, therefore, is not to command healing, but to accompany it with understanding. This perspective reframes the nurse's role from an authoritative director of recovery to a supportive partner in the healing journey. Accompanying implies walking alongside, offering support, and sharing the burden, rather than leading from the front or dictating the path. It speaks to a profound respect for the individual's inherent capacity for resilience and their unique process of navigating illness and wellness, fostering a collaborative approach to care. Understanding, in this context, extends beyond the mere comprehension of medical facts or physiological processes. It encompasses an empathetic grasp of the patient's lived experience, their emotional landscape, and their personal values. This deeper understanding allows the nurse to tailor care that resonates with the individual, respecting their cultural background, spiritual beliefs, and personal preferences. It is through this comprehensive understanding that true accompaniment becomes possible, fostering a therapeutic alliance built on trust and mutual respect, thereby humanizing the entire care experience. The very act of accompanying healing also introduces a delicate paradox. The nurse provides expert care and knowledge, yet must simultaneously step back to allow the patient's own journey to unfold. It is a dance between intervention and observation, between active support and respectful space. This coexistence of opposites, the assertive application of clinical skill alongside the gentle art of non-interference, defines a significant aspect of ethical nursing. The limits of logic often become apparent when attempting to reconcile these inherently complementary, yet seemingly contradictory roles within a single framework of practice. one might reflect on the inherent mystery of healing itself, acknowledging that much of the process remains beyond direct command or complete scientific manipulation. The nurse, despite all skill and knowledge, is ultimately a facilitator, not a sole orchestrator of recovery. This perspective fosters a sense of humility, recognizing the profound biological and psychological forces at play that are not entirely within human control. The ethical stance, therefore, embraces a certain degree of uncertainty, accepting that outcomes may not always align with intentions or expectations, thus requiring adaptability and resilience. The ongoing ethical dialogue in nursing fundamentals thus continuously grapples with the boundaries of professional influence and the sanctity of individual agency. It questions how to best serve without imposing, how to protect without disempowering, and how to guide without controlling. This perpetual inquiry into the meaning of care itself ensures that nursing remains a deeply humanistic endeavor, constantly evolving its understanding of what it means to heal and to be healed. The commitment to accompanying healing with understanding forms the enduring ethical compass for the profession, guiding its moral trajectory. This philosophical lens encourages a constant self-reflection among practitioners regarding their motivations and methods. It prompts an examination of power dynamics inherent in the care relationship, striving to mitigate any imbalance that might undermine patient autonomy. The nurse, in this view, becomes a guardian of dignity, a facilitator of choice, and a steady presence in the face of vulnerability. It is a role that demands not just intellect and skill, but also profound empathy and an unwavering moral compass, ensuring that care is delivered with integrity. The pursuit of ethical clarity within nursing is not about finding definitive answers, but rather about refining the questions one asks. It is an acknowledgement that the human condition, in its complexity and fragility, resists simple solutions and demands continuous moral engagement. One may find that the true strength of nursing ethics lies in its capacity for ongoing adaptation, its willingness to confront difficult dilemmas, and its commitment to placing the patient's unique experience at the center of all considerations, thereby embracing ethical pluralism. The inherent tension between universal ethical principles and the particularities of individual cases further complicates this philosophical landscape. While broad guidelines provide a framework, each patient encounter presents a unique constellation of values, beliefs, and circumstances. This necessitates a flexible and context-sensitive application of ethical reasoning, moving beyond rigid adherence to rules towards a more nuanced, person-centered approach. It appears that the art of ethical nursing resides in this delicate balance between the general and the specific, requiring astute judgment. Moreover, the ethical considerations extend beyond the individual patient to encompass broader societal implications of nursing practice. Questions of justice, equitable access to care, and the allocation of resources also fall within the philosophical scope of the profession. How might one ensure that the principles of autonomy and protection are upheld for all, regardless of their social standing or economic means? Such inquiries highlight the expansive reach of ethical reflection within nursing fundamentals. Connecting individual care to collective well-being, the quiet endurance of service, when viewed through an ethical lens, also prompts reflection on the sustainability of compassionate care. How does one maintain a deep sense of duty and presence without succumbing to moral distress or burnout? This question underscores the ethical obligation nurses have to themselves, recognizing that self-care is not a luxury, but a prerequisite for providing sustained, high-quality ethical care to others. It could be said that ethical practice begins with a recognition of one's own human limitations and needs, advocating for a balanced approach. The very act of defining healing itself becomes a philosophical endeavor within nursing. Is healing merely the absence of disease, or does it encompass a broader restoration of well-being, meaning, and connection? This deeper understanding of healing informs the ethical approach to care, guiding nurses to consider the holistic dimensions of a person's health. It suggests that true ethical accompaniment involves supporting individuals not just to recover physically, but also to find peace and purpose amidst their health challenges, thereby addressing the spiritual aspect of care. The philosophical inquiry in nursing fundamentals thus demands a continuous engagement with fundamental human questions. What does it mean to suffer? What does it mean to alleviate suffering? What is the nature of human dignity? These questions, though abstract, directly inform the concrete ethical choices made in daily practice. They compel nurses to reflect on their own values and biases, ensuring that care is delivered with integrity and genuine respect for the other, fostering an environment of profound human connection. The dynamic interplay between empirical knowledge and ethical wisdom forms another crucial aspect of this philosophical landscape. While scientific evidence guides clinical interventions, ethical principles provide the moral framework for how those interventions are applied, and why they are chosen. It is the integration of these two domains that elevates nursing beyond a technical skill to a profound moral art. The limits of logic often become apparent when attempting to reduce complex ethical dilemmas solely to empirical data. Highlighting the need for moral intuition, one might consider the ethical responsibility inherent in the nurse-patient relationship as a form of sacred trust. This trust is built upon the patient's vulnerability and the nurse's commitment to act in their best interest, guided by principles of beneficence and non-maleficence. Maintaining this trust requires unwavering honesty, transparency, and a consistent demonstration of ethical integrity. It appears to be a foundation upon which all effective and compassionate nursing care is constructed, reinforcing the importance of professional virtue. The ongoing dialogue concerning autonomy and protection also extends to the realm of advocacy. Nurses are often called upon to advocate for their patients, ensuring their voices are heard and their rights are respected within complex healthcare systems. This advocacy is an ethical imperative, requiring courage, discernment, and a deep commitment to social justice. It could be said that advocacy embodies the active expression of the philosophical commitment to accompanying patients with understanding, championing their fundamental human rights. Ultimately, the philosophy of nursing fundamentals is an invitation to perpetual reflection on the moral dimensions of human care. It is a recognition that healing is a journey, not merely a destination, and that the nurse's role is to be a steadfast, understanding companion along that path. The ethical landscape is rich with nuance and complexity, demanding a continuous engagement with the profound questions that arise from the act of caring for another human being. This sustained inquiry forms the very heart of professional nursing, ensuring its enduring relevance and its deep humanistic purpose. The pursuit of ethical excellence in nursing is therefore an unending process, a continuous striving for greater clarity and compassion in practice. It acknowledges that perfect solutions are rare, and that moral dilemmas often involve choosing between competing goods. This acceptance of inherent ambiguity is itself a philosophical stance, fostering humility and a commitment to ongoing learning and reflection. It is in this space of thoughtful engagement that the true depth of nursing's ethical framework resides, guiding practitioners through the intricate tapestry of human suffering and healing. The limits of logic are perhaps most evident when confronted with the existential questions that often accompany illness and end-of-life care. No purely rational framework can fully encompass the grief, fear, or spiritual longing that patients and families experience. Here, the ethical imperative transcends mere problem-solving and enters the realm of compassionate presence and profound empathy. It could be said that the deepest ethical challenges in nursing often require a wisdom that extends beyond logical deduction, embracing the full spectrum of human experience. The quiet endurance of service, when illuminated by philosophical inquiry, reveals a profound ethical commitment to sustain hope and provide comfort, even when healing in a medical sense is no longer possible. This is where the meaning of care itself expands, embracing the art of palliative presence and the dignity of a peaceful passage. It reinforces the idea that accompanying with understanding is paramount, regardless of the clinical trajectory, honoring the patient's journey to its very end. The academic tension inherent in balancing guidance and control also highlights the ethical responsibility to cultivate critical self-awareness. Nurses must constantly scrutinize their own biases, assumptions, and power dynamics to ensure that their interventions genuinely serve the patient's best interests rather than reflecting personal preferences or institutional pressures. This continuous internal dialogue is a cornerstone of ethical practice, promoting integrity and accountability. The philosophical journey through the ethics of healing in nursing fundamentals thus reveals a landscape rich with moral complexity and humanistic depth. It underscores that the profession is not merely a technical application of skills, but a profound commitment to the human spirit. The ongoing dialogue between autonomy and protection, choice and safety, guidance and control, forms the enduring ethical core. This continuous reflection ensures that nursing remains grounded in empathy and dedicated to the holistic well-being of those it serves. This constant negotiation between ideal principles and practical realities forms a subtle paradox within the daily life of a nurse. One strives for perfect ethical adherence, yet must always operate within systems that present limitations and compromises. This inherent tension does not diminish the ethical commitment, but rather refines it, fostering a pragmatic wisdom that seeks the greatest good within existing constraints. It is a testament to the adaptability of ethical thought in the face of complex human needs, embracing the ambiguities of care. The quiet endurance of service, when viewed philosophically, also speaks to the moral courage required to face suffering directly, without turning away. This steadfast presence, even in the most challenging circumstances, embodies a profound ethical commitment. It is a testament to the nurse's dedication to upholding dignity and offering comfort, regardless of the patient's condition or prognosis. This steadfastness becomes a beacon of hope for those in distress, offering solace in times of profound vulnerability. The ethical framework of nursing fundamentals, therefore, is not a rigid doctrine, but a living, breathing philosophy that adapts to the evolving human condition. It continuously challenges practitioners to deepen their understanding of care, to refine their moral reasoning, and to strengthen their commitment to ethical practice. This ongoing intellectual and emotional engagement ensures that nursing remains a profession dedicated to the highest ideals of human service, perpetually seeking moral excellence. One may conclude that the philosophy of nursing, at its heart, is an enduring exploration of what it means to be truly human in the face of vulnerability. It is a constant striving to accompany others with understanding, to navigate ethical complexities with wisdom, and to provide care that honors the inherent dignity of every individual. This profound ethical commitment forms the bedrock of nursing fundamentals, offering a compass for all who walk this path, guiding them toward compassionate and principled action. How then does one sustain this profound ethical commitment amidst the relentless demands of practice? ensuring that the quiet endurance of service never wanes into mere routine, but remains perpetually infused with understanding and genuine presence. After the rigorous processes of intellectual engagement and analytical reasoning, a period of quiet reflection naturally emerges. This stillness allows the accumulated knowledge of nursing fundamentals to gently settle, turning inward to reveal deeper, more subtle understandings. It is in this contemplative space that the essence of care begins to transcend mere performance. Care may then be perceived not merely as a series of tasks performed, but as a profound awareness shared between individuals. This shared presence forms a vital aspect of fundamental nursing practice, influencing every interaction. The nurse, in this reflective state, learns as much from the eloquent pauses and unspoken cues as from structured study. Within the quiet spaces of interaction, one often discerns insights that formal curricula alone might not convey. This silent observation becomes an integral component of fundamental nursing education, shaping a more holistic understanding of human needs. It suggests that a significant portion of nursing wisdom resides beyond explicit instruction. One may pause to consider what it truly signifies to witness the unfolding narrative of another's life. This profound act of bearing witness lies at the very heart of the nursing role, demanding a deep, empathetic presence. It is a quiet acknowledgement of shared humanity in moments of vulnerability. In this persistent inquiry, nursing discovers its own meditative core, where intellectual understanding transforms into quiet presence. This presence, in turn, often engenders a profound sense of peace, both for the giver and the receiver of care. The quietude allows for an authentic connection to form. Yet, the integration of such silent, intuitive knowledge with established procedural frameworks presents a continuous conceptual challenge within nursing education. This tension highlights the dynamic interplay between objective skill acquisition and subjective insight. It requires a delicate balance in practice. The essence of fundamental nursing may thus reside in this delicate balance between active intervention and receptive observation. It is a practice inherently attuned to the unspoken rhythms of human experience, demanding a nuanced sensitivity. This attunement fosters a deeper appreciation for individual circumstances. Through such introspective engagement, the nurse cultivates an inner landscape of empathy and quiet understanding. This internal development appears as crucial as the acquisition of technical proficiencies, enriching the overall quality of care. It shapes the character of the caregiver. The value of this reflective dimension extends beyond measurable outcomes, influencing the quality of interaction itself. It tends to foster an environment of profound human connection and dignity, which are often intangible yet deeply felt. This intrinsic worth is not easily quantified. A quiet wisdom often emerges from these moments of shared vulnerability and silent communion. This wisdom subtly informs the nurse's subsequent actions and perceptions, guiding decisions with a gentle assurance. It is a form of knowing that deepens over time. The practice of nursing, at its most fundamental level, involves a constant negotiation between doing and being. One must act with precision, yet also be present with an open heart, allowing for the emergence of silent knowledge. This dual orientation defines the art of care. Reflection offers a pathway to understanding the subtle energies that flow between individuals in a care setting. It illuminates the unwritten rules of interaction and the unspoken needs that often guide patient responses. This insight is invaluable for truly person-centered care. The quiet understanding gained through sustained presence can often anticipate needs before they are articulated. This anticipatory care, rooted in deep observation, exemplifies a mastery of fundamental nursing principles. It speaks to a profound level of attunement. Every interaction, every shared moment, contributes to a repository of silent knowledge within the nurse. This cumulative wisdom shapes their intuition and enhances their capacity for compassionate engagement. It is a continuous, organic learning process. The act of witnessing another's journey, particularly through periods of illness or recovery, imparts lessons beyond any textbook. These lessons are absorbed through empathy and quiet contemplation, becoming an indelible part of the nurse's professional identity. They inform future encounters. Nursing fundamentals, when viewed through the lens of reflection, reveal themselves as a foundation not just of skills, but of a way of being. This way of being prioritizes presence, respect, and a deep reverence for human experience. It is a philosophical stance towards care. The stillness that reflection provides allows one to discern patterns in human behavior and response that might otherwise be overlooked. These subtle patterns often hold keys to understanding individual coping mechanisms and preferences. They guide personalized care strategies. It could be said that the most profound insights in nursing often arise not from active searching, but from receptive waiting. This patient receptivity allows for the authentic needs of another to surface without imposition. It is a gentle, yet powerful, approach. The silent knowledge cultivated through reflection fosters a resilience within the nurse, enabling them to navigate complex emotional landscapes with greater equanimity. This inner strength is crucial for sustaining a career in compassionate care. It protects against burnout. Understanding becomes a form of presence, where the nurse's entire being is engaged in the moment of care. This holistic engagement moves beyond mere intellectual comprehension to a deeper, more embodied knowing. It creates a therapeutic atmosphere. This reflective approach to nursing fundamentals emphasizes the importance of the internal state of the caregiver. A calm-centered nurse is better equipped to provide truly compassionate and effective care, regardless of external pressures. Inner peace contributes to outer efficacy. The quality of care, therefore, is not solely dependent on technical proficiency, but also on the depth of the nurse's reflective capacity. This capacity allows for continuous growth and adaptation, ensuring that care remains responsive and humane. It is a lifelong practice. In the quiet moments following a complex situation, reflection allows for a processing of events that deepens understanding and refines future responses. It transforms experience into wisdom, making each challenge a learning opportunity. This is how expertise develops. The meditative core of nursing, found in this reflective stillness, invites a constant re-evaluation of what truly constitutes healing and support. It encourages a perspective that values the spirit as much as the body. This holistic view is paramount. This inward turning of knowledge allows the nurse to connect with their own humanity, which in turn enhances their ability to connect with others. It fosters genuine empathy and reduces the distance between caregiver and care recipient. It builds rapport. The silent knowledge of nursing fundamentals is a testament to the fact that some of the most crucial aspects of care cannot be taught through lectures alone. They must be cultivated through experience, reflection, and an open heart. This makes nursing an art. One might consider the quiet dignity that emerges from a nurse's reflective presence, offering solace without words. This unspoken reassurance often provides comfort that surpasses any verbal explanation. It is a profound act of compassion. The understanding that arises from reflection is often characterized by its intuitive nature, guiding decisions with a subtle certainty. This intuition, owned by experience and contemplation, becomes a powerful tool in complex situations. It complements analytical thought. This approach to nursing fundamentals encourages a continuous dialogue between theory and practice, mediated by personal reflection. It ensures that knowledge is not merely accumulated, but deeply integrated into one's professional identity. It fosters critical thinking, the quiet acceptance of uncertainty, a hallmark of deep reflection, allows the nurse to operate effectively, even when answers are not immediately clear. This capacity for embracing ambiguity is vital in dynamic healthcare environments. It promotes adaptability. Reflection transforms the routine aspects of nursing fundamentals into opportunities for profound insight and personal growth. Every task, however small, can become a moment for conscious engagement and learning. It elevates the mundane. The silent knowledge underscores the importance of the human element in nursing, reminding one that technology and protocols are always in service of a person. This human-centric view is fundamental to ethical and effective care. It prevents dehumanization. It appears that the most effective nursing care flows from a place of inner calm and clarity, nurtured by consistent reflection. This inner state allows for a more focused and compassionate engagement with patient needs. It enhances professional presence. The contemplative dimension of nursing fundamentals acknowledges that healing is not solely a physical process, but also an emotional and spiritual journey. The nurse's presence in this journey is a vital source of support. It addresses the whole person. Through reflection, the nurse learns to navigate the complexities of human suffering with greater wisdom and less personal distress. This emotional intelligence is a crucial, though often unstated, fundamental of nursing. It supports emotional resilience. The quiet strength derived from reflective practice allows the nurse to remain steadfast in challenging circumstances, offering stability to those in their care. This unwavering presence is a cornerstone of trust and therapeutic relationship. It projects confidence. This inward turn encourages a deep respect for the individual's autonomy and their unique path through illness or recovery. It fosters a non-judgmental stance, promoting a truly empathetic interaction. It honors personal choice. The silent language of care, understood through reflection, often communicates more effectively than any spoken words. It conveys empathy, reassurance, and a profound sense of being understood. This non-verbal communication is powerful. Reflection allows the nurse to process the emotional impact of their work, ensuring that they remain empathetic without becoming overwhelmed. This self-awareness is essential for maintaining professional boundaries and personal well-being. It prevents emotional fatigue. The meditative quality of this reflective practice brings a sense of groundedness to the demanding profession of nursing. It anchors the nurse in the present moment, enhancing their ability to respond effectively and calmly. It fosters presence of mind. It could be argued that the true mastery of nursing fundamentals lies not just in knowing what to do, but in knowing how to be. This being is cultivated through sustained reflection and an openness to silent knowledge. It defines true expertise. The quiet observation of subtle changes in a patient's demeanor or vital signs often provides crucial information that formal assessments might miss. This keen observational skill is a product of reflective engagement. It enhances diagnostic acumen. This reflective stance fosters a deeper appreciation for the interconnectedness of all aspects of care, from the physical to the psychological and social. It encourages a holistic perspective that is essential for comprehensive nursing. It promotes integrated care. The capacity for stillness allows the nurse to truly listen, not just to words, but to the underlying emotions and concerns that patients may struggle to express. This deep listening is a fundamental act of empathy. It builds trust and understanding. The silent knowledge gained through reflective practice often informs ethical decision-making. guiding the nurse toward the most compassionate and just course of action. It provides a moral compass in complex situations. It strengthens ethical reasoning. This inward focus on the essence of care helps to prevent nursing from becoming a purely mechanical exercise. It preserves the humanistic core of the profession, ensuring that compassion remains central. It maintains professional integrity. The quiet confidence that emerges from a well-developed reflective practice allows the nurse to act decisively, yet gently, always prioritizing the patient's well-being. This balanced approach is highly effective. It combines competence with empathy. Reflection provides a space for the nurse to acknowledge the inherent paradoxes and uncertainties within healthcare, fostering a sense of acceptance rather than frustration. This philosophical perspective aids in coping with ambiguity. It promotes resilience. The silent wisdom of nursing fundamentals teaches that sometimes the most profound interventions are those that involve simply being present and holding space for another's experience. This non-doing is a powerful form of care. It offers solace. This meditative approach to nursing encourages a continuous learning process that extends beyond formal education, drawing lessons from every patient encounter. It transforms daily practice into a journey of discovery. It fosters lifelong learning. The quiet understanding of human vulnerability, cultivated through reflection, deepens the nurse's capacity for empathy and compassion. This profound connection is a hallmark of truly exceptional nursing. It enriches the care experience. It appears that the most enduring lessons in nursing are often learned in the quiet moments of shared humanity, rather than in the bustling intensity of clinical procedures. These moments shape a nurse's fundamental approach. They are deeply impactful. The reflective practice allows the nurse to discern the subtle interplay of hope and despair, strength and vulnerability that characterizes the human experience of illness. This nuanced perception guides sensitive care. It fosters a balanced perspective. This inward turning of knowledge transforms nursing from a mere occupation into a profound vocation, imbued with meaning and purpose. It elevates the daily tasks to a higher calling. It instills a sense of mission. The silent knowledge of nursing fundamentals emphasizes that care is not just about what is done for a patient, but also about the quality of the relationship established. This relational aspect is foundational. It builds rapport and trust. Through reflection, the nurse comes to understand that moments of stillness are not empty but are rich with potential for insight and connection. These pauses become opportunities for deeper engagement. They are generative. This contemplative approach acknowledges that the true art of nursing lies in its ability to adapt to individual needs, guided by an intuitive understanding that transcends rigid protocols. It emphasizes personalized care. It fosters flexibility. The quiet presence of a reflective nurse can often de-escalate anxiety and foster a sense of safety, creating an environment conducive to healing. This calming influence is a vital therapeutic tool. It promotes well-being. The silent wisdom gained through witnessing life's most intimate moments instills a profound respect for human dignity and resilience within the nurse. This respect informs every aspect of their practice. It underpins ethical conduct. One might then consider, how does the silent resonance between beings fundamentally shape the very definition of care within any given moment? This question invites a deep, personal exploration of nursing's core. In this quiet contemplation, the true depth of nursing fundamentals gently reveals itself, inviting a sustained stillness. Nursing fundamentals, in its profound manifestation, tends to return as the quiet rhythm of life itself. It appears to weave through existence a subtle pulse of support, This enduring presence suggests an intrinsic connection to cycles of human well-being. The essential principles of this discipline echo natural cadences found in the world. One may observe a mirroring of growth and renewal, of challenge and peace. This deep resonance allows the field to integrate seamlessly into broader narratives of living. Within this framework, knowledge and empathy remain inextricably intertwined. Intellectual understanding, when illuminated by human connection, forms the bedrock of practice. This vital synthesis ensures care is both informed and deeply felt. Such a profound connection sustains delicate balance throughout all aspects of care. Meticulous attention to detail maintains stability, preventing potential shifts. This careful vigilance ensures every nuance of need is observed and addressed. Furthermore, the importance of rest for both cared for and provider becomes evident. Periods of quiet restoration are crucial for healing, allowing body and mind to recalibrate. This understanding of repose is fundamental to the continuum of well-being. The field of nursing fundamentals endures as both rigorous science and profound solace. Its methodologies provide necessary structure and evidence for intervention. Simultaneously, its humanistic core offers comfort and reassurance in vulnerability. One might consider the quiet power of this dual nature, where objective truth meets subjective experience. The ongoing pursuit of knowledge tends to refine techniques, while commitment to compassion elevates the spirit. This unique blend defines its lasting legacy. Yet, the intricate dance between scientific protocols and intuitive demands might always present a subtle, ongoing tension. Individual responses tend to challenge even comprehensive frameworks. This inherent variability underscores the continuous need for adaptive understanding and gentle flexibility. Thus, the final thought emerges. Care continues its quiet work, extending beyond the waking hour. Its influence resonates through the stillness of the night, a silent promise of vigilance and support. The dedication to healing persists, a constant, underlying current in existence. All understanding now finds its moment of quiet repose.